Good afternoon. I'd like to call to order the Cabarrus County Board of Commissioners work session for April the 2nd, 2012. Let's see. The first thing that we have is approval of the work session agenda. You have that before you, Commissioners. Do I have a motion to approve the work session agenda? Have a motion second. All those in favor say aye.
Aye.
Any opposed? Okay. Commissioner CARRUTH is on his way, so he'll be here in just a few. We are going to move things a little slightly out of order. Dr. Pilkington, I believe, needs to leave early or needs us to move his item up. He's got a flight to catch, so if the Health Alliance will come up. And we're going to start with their report. Again, for the viewing public, just to let you know that in our work sessions leading up to our budget meetings, we are inviting different groups to come in and talk to us about their budgets and what they mean so that we all can better understand what their budgets are and the different components of it. We have not had budget meetings yet as commissioners, so we have not made any decisions on the budgets at this point in time. Staff members have been working, and of course all the different entities that we fund have been working on their budgets. So I, for one, have not been on the Health Alliance Board, so it's always educational for me to learn about the different things that you guys are responsible for, which is quite a lot in the county. So we're glad that you're here today, and we'll turn the microphone over to you.
Well, I'm going to go ahead and start off as chair of the board. Fred's going to provide, basically he's going to keep me honest, fill in the details, and Tammy knows all the numbers. But I'd just like to give you a little bit of background. The Health Alliance was started in 1997. And initially, we had an agreement for per capita funding, and we made an agreement with the county commissioners that if they would give us X amount of dollars per head, we just wouldn't come back and ask for more. And we've done that. And so for 15 years, we have maintained the same rate of funding with no increase for inflation, and that's about a 30% cut, frankly. If you look at any other department in the county, I cannot imagine they have not received some market rate adjustments over the last 15 years. We've received none, and we've managed to make do with that. And we're not protesting that at this point. My point is we don't want to see more cut. We feel like we've had enough cut already with that 30%. And the results would be somewhere between very bad and catastrophic for the people in this county. And there are a couple of perspectives there. One is from an economic development perspective, we want to have a county that is attractive to industry, that has good infrastructure, good recreational facilities, and that is a healthy county. We have, in large part, I think, are responsible for our ranking as the number 8 county in the state in terms of health. And this is a real good marketing tool. If you can say we're in the top 10% in this state, it is something that will be attractive to corporations, particularly the kind we want to bring in. But if you cut our budget to the extent that it has apparently been proposed, we can't sustain that. I will just tell you right now, it will not happen. And there are two areas where I understand that are under consideration for cuts. One is what is titled rent. And that is what we had paid to the county for the space at the old Kmart building, the Human Services building. And now we have a new building, courtesy of Kannapolis, which we appreciate. But that has not cost the county commissioners anything out of your budget. And we need that money to maintain that building, frankly. We want to make sure it stays in good shape, and we have a choice. We either cut services that are already cut pretty much to the bone. Over the past couple of years, we've had layoffs, we've had program cuts. You keep cutting programs, and pretty soon there are serious consequences for the public. And another area is clinical services, and this is something where we had hoped to have 2 physicians here from our staff, Lenny Baker and Russ Suda. Lenny Baker has been in the community for a long time. He was my kid's pediatrician. And we'd hoped they would be here to address what the actual consequences to women and children in the community will be. But I can tell you it'll be bad. Our infant mortality rate will go up. our maternal death rate will go up. And these are the kind of things that will seriously impact our standing in the state in terms of health as a county. And we will not be able to maintain that top 10 rating. And from a personal perspective, I am a rather conservative person myself. My dad was the first Republican county commissioner in Moore County since Reconstruction. I campaigned for Barry Goldwater, and if you don't know how conservative he was, you need to look, because he's kind of the archetype. And when I was a teenager, I was out banging on doors trying to get people to go vote for him. And I believe that spending should be limited to the absolute minimum that is appropriate for each level of government. And we won't get into stuff like departments of education at the federal level. Anyhow, I feel like public health is recognized by the state as an appropriate fiscal responsibility for counties, and we have been funded well over the years, but I am asking that you maintain that. And we do have a couple of wonderful folks here, and I was just telling them about some of the potential cuts that we would have to services, and I would appreciate it if the two of you would weigh in on what that's going to mean for the community in terms of women and children. Could you?
Well, I appreciate the opportunity to address this committee. I'm the medical director. I'm Russell Suda. I'm an obstetrician gynecologist. I've been working there for going on 8 years now, and it's been a pleasure. We've delivered during that time period about 4,000 babies, or 4,000 babies have come out of our clinic during that time period. We deliver 400 to 600 a year. We have about 1,000 open charts every year. 980 was actually, I believe, last year, and right around 900 the year before. We're on track to get up to around 1,000. In terms of patient visits, we have about 8,000 patient visits a year in maternity. We're on track to get to about 10,000 this year. So we do quite a bit of obstetrics. Why are we important? Well, I think the main reason we're important is because we've managed indigent patients, patients on Medicaid, patients who are self-pay with no insurance, and that's a big. There's a big difference between managing that patient population and a private patient population, which is where I assume the patients would have to go if we didn't do maternity services, and that's a large volume of those services too. We have a focus on the problems of being deprived, of being poor. That focus includes looking for substance abuse, looking for depression, looking for malnutrition, and having services to address those problems underneath our roof. Don't have to send them across town. Don't have to make comments like, you know, it would be really nice if you got a nutrition consult because you're really losing weight, and that's really potentially affecting your baby. In fact, our last ultrasound showed that your baby is growing smaller. That kind of thing we address right under our roof. We've now got ultrasonography coming on board to help us with that as well. We're looking for substance abuse, depression, domestic violence. All these issues are much more of a problem in the indigent population, and they don't go away no matter where you send them. What you don't do is you don't diagnose it, you don't address it, and you deal with the repercussions of that after it occurs and gets to a problem where it's so exacerbated that you're trying to, you know, basically curtail or cut the damages, which I'm afraid is what potentially could happen here. Let's look at one case scenario here that I think is very important. It has to do with logistics. If you look at Medicaid patients get into the private offices. We presently have about 50% Medicaid, and we range in self-pay patients from 44% 2 years ago. We're now over 50% with self-pay patients. Those patients will not get in to private practices because they have to have a certain amount of money up front. And you know, I don't want to speculate on how much that is because I've heard different numbers for different practices, but I can tell you it's prohibitive for the type of patients that we're managing. So they're not going to get in and they're not going to get their care. They'll exit. I've had patients do this many times. Send them for a consultation. They go to a private office, okay, one of the specialists, a pulmonologist or what have you. They walk in, they anticipate that the patient's going to put a certain amount down. They walk out. The next time they come in and see me, I say, how was your visit with Dr. So-and-so, relative to this asthma problem we've got? Oh, I wasn't able to see him. What was the matter? Well, they wanted money up front and I didn't have it, so they just exited. This kind of thing is very, very common, and it's going to be an issue we're going to see more of. But not just for referral patients. This is for the whole body of self-pay patients, which again is 44 to 51% of the patients that we see. And if that's 8,000 visits a year, the math is simple. You're talking about 4,000, 4,200 visits a year that aren't going to occur. And those visits are very critical. There's no area of medicine that I know of that's more critical in terms of preventive care. And the Affordable Care Act, when you boil it down, is all about health and wellness, is all about prevention, all about screening early disease and treating disease early, okay? When you lose the opportunity to treat antepartum patients, you're losing the opportunity to really cause, to stop problems from developing down the road. When they did the perinatology studies back in the 80s and 70s, and they were referring people down to tertiary care centers, and they found out how to do that correctly, they identified that for every dollar you spend on antepartum care for a pregnant woman, you save $5 in the delivery of health care services to that baby in the neonatal intensive care unit. This is just, I'm just touching on the top of the problem. I've got more notes here to give, and I know we have a limited amount of time. I really appreciate this time. It's so valuable to us to get our point across. But I want to turn it over to Dr. Baker, who is our esteemed pediatrician, and he's going to address the children's.
If I could just interject one thing,
Yeah.
Russ, and I think you'll confirm this. At this point, there is not capacity, regardless. If we gave every one of the patients we are seeing a first-line insurance policy, there's not capacity in town to take them. Is that true?
Well, the obstetric, I would say, yes, I would say it has to be true. I haven't done that math. Dr. Baker's going to address
We've got about
that.
a third of the patients. I can't imagine the existing practices could absorb that.
They've got one new relatively new OB practice, but it only has 2 physicians in it, and they're looking to expand their OB practice. They're not going to be able to absorb all of this. No, I would agree. Okay. I don't know how much the other ones can absorb, but I would dare say that there's not enough obstetrical services available in the community to meet the demand.
Lenny? Sorry to interrupt.
I've been a pediatrician since 1963 and been in this area all that time. I retired from my private practice at Cabarrus Pediatric Clinic in '98, and I've been at Health Alliance since that time. And I've always been a strong advocate for children. And I think children, as we look at the health care system, really have been neglected. We provided for our senior citizens with Medicare, but we haven't done much for children. We have Medicaid. That leaves a whole host of kids without any type of health insurance and without access to good health care. Kids are our future. And if we don't change the way we practice medicine in this country and start talking about prevention, starting with kids, we're going to be in a big mess down the road 20 years from now. Obesity is going to break the bank. So we have got to change lifestyles, and you got to start when they're kids, and you got to provide them with good care and good education. And I think we're doing that at the Health Alliance. And in the Accountable Care Act, one of the things that pediatricians like about it, and the American Academy of Pediatrics is strongly supporting this, is it widens the coverage for children. More kids will be under some type of health insurance, probably Medicaid to start with. But I think the Medicaid rolls will expand immediately if that's passed. And many people think that even if the whole thing doesn't pass, the part for children could and should. I think we have a moral obligation to provide health care for children. I think for everybody. We're one of the few countries in the world that doesn't provide health care for our citizens. So the Medicaid rolls would expand immediately. And I think we're working at capacity now. There are 2 of us. We share a position, so we have 1 full-time pediatrician. at the Health Alliance. And I think we do a good job utilizing our nurses and our family nurse practitioners, and that's what I think we're going to have to do down the future. We'll have a shortage of doctors, and so I think we're going to have to utilize ancillary people in taking care of our population. Right now, we have a bit over 3,000 children in our practice. 78% of those are Medicaid. So far in 2012, 83%. We have 6% that have some type of insurance, and private pay, which is probably no pay, is 16%. We also do $15,000 a year of services to the community care plan. We have a number of patients that are in the community care plan. That's the group of people who don't have Medicaid, they don't have any kind of insurance and can't afford insurance. So they sort of fall through the cracks. Well, as I said, we're big on prevention, and a part of that is immunizations. And we had the highest immunization rate of any county in the state. We were higher than the national average for immunizations. We were over 83%, and we're proud of that. We do a lot of other things in nutrition and preventive services for our kids. And I think that we are uniquely qualified to take care of this population of children. I think we can do a better job with them than the private pediatricians can. They don't have the time and they don't have the resources to deal with a lot of these issues that we have and we can. We're a medical home for these kids. We have a lot of kids with, that are handicapped, who have special needs, and we're sort of the triage for those people. We get them in the right places where they need to be to get the kind of care they need. So I think if we lost our pediatric clinic, it would be a terrible loss. I think the private physicians would have a hard time taking this population of patients over, and particularly if the Medicaid population grows, as I'm sure it will. I feel sure that more and more kids are going to be given some type of insurance. We can't take care of all of them. We're going to have to utilize our resources better. And I think the Health Alliance is one of those good resources that we have. And I've been associated with the Alliance in the health department ever since I've been in town, really, since '63. And they've done some wonderful things for this community. So we immunized virtually everybody in Cabarrus County to polio back in '64 when oral polio first came out. We immunized a huge percentage of the population against measles, German measles and red measles. So we've been about prevention for a long, long time, and we're still going to be about prevention. I think that's where the key is in medicine.
Actually, this county was the first in the nation to immunize all our school children for polio. We're number one, literally. If our budget is cut, it's already pretty bare bones. We've been through the ringer. I mean, if nothing else, like I said, we've had essentially a 30% cut over the past 15 years. We're going to have to look at some kind of program cuts, and at this point, school nurses are one of our programs. I am a strong supporter of the school nurse program, but I am only one vote on that board. I can't guarantee that we could maintain our school nurse program. It's exceeding expensive, and something's going to have to give if you cut our budget, and I can't tell you what that's going to be. I would hate to see any of the programs cut. But that's a decision you have to make. You have the big picture in mind. I feel like public health is a very vital part of the big picture, not just for the health of the community, the physical health of the community, but also for the economic health of the community. And I hope you wouldn't be short-sighted and be penny-wise and pound-foolish and cut our budget and then end up with economic shortfall by the community going downhill. And I appreciate the opportunity to speak with you. And I feel like it's kind of a desperate situation for us. And I hope we'll receive favorable consideration.
Dr. Pilkington, do you want to add?
Just one point I'd like to add, which is very significant, and I think all of you know this from reading the newspaper. This year we ranked second in the state for the best infant mortality rate out of the 100 counties. I came here 30 years ago, 31 almost, believe it or not. And 31 years ago, we ranked, I think, 96th. So we've done a lot to improve that. And infant mortality, as I've told you over and over each year, is the #1 indicator of how healthy you are as a community. So we really stack up there. Again, remembering that the United States ranks 23rd in the industrialized world in infant mortality, not too good. And North Carolina usually ranks between 37th and 49th. So we've done a very good job. Again, that's folks like Dr. Baker and Dr. Suda, but those, just a single infant death or a single maternal death to me are significant. And we're spending on an average of your county contribution $50 per patient. That's what it comes out to, about 7,000 patients per year. So to me, to save those lives, and it really comes down to saving lives because we have gone so long. We had one maternal death last year, Dr. Suda. First one in quite a while that we've had. Maternal deaths are something that you don't see much anymore in any community. And we've been able to make sure that doesn't happen because of this system where a woman gets care before she has to go to the hospital. She doesn't, when we started having a doctor in the hospital, and Dr. Vince Area was our first doctor at the health department, we would have between 60 and 90 deliveries a year with no prenatal care. And you know the risk of that when you have women just showing up ready to have a baby. There's all kinds of things that can go wrong and do go wrong. And Dr. Suda can tell you they go wrong now, but he's usually there to take care of them. So we're doing a great job. Tomorrow will come the rankings, the national rankings, where every single county in the state, in the nation is ranked. We will rank 8th in North Carolina. That's an embargoed figure for those of you from the press here, so it'll be out tomorrow. And we will rank in the top 10% of all counties in the United States. Again, really, really important and significant. I think all of you should be proud of that. As I've said to you over and over again, that happened because we've always had strong support from our Board of Commissioners, and we always appreciate that. It makes a difference. We rank, even though it's slipped, we still rank in the top 20 of the 100 counties in support from the county commissioners. One time we ranked 3rd. We're no longer that high anymore, but we still rank in the top 20, which I think is a credit to all of you. And between what you've done, folks like Dr. Baker have done, he's been with us so long, it's amazing. The work that folks like all of you have done to make this such a county of pride to work in, and it's what's I've been the most proud of over these 31 years because I assure you I would have left many times beforehand if it weren't for the people like you that I work with that make it so easy. So I appreciate it, and I just hope you'll keep that in mind that it's $50 per patient per year. That's not a lot of cost to the county.
All right, commissioners, do you have some questions?
I got some questions. Dr. Suda, you said that 50% of the patients are Medicaid and a little bit over 50% are self-pay, no insurance.
Yes.
And if the clinical services were to go away, then they would have to be absorbed by the emergency room or local clinics. Is that correct?
That would be my take on it, yes.
Okay. And how much, so what does that mean to the county if they don't have prenatal care? I mean, children aren't going to be born healthy, or there's going to be some issues with the complications with the delivery?
Well, what'll happen is patients will, gestate at home and then come in when they have a problem or else when they're in labor. And of course, trying to mitigate the problems of pregnancy occurs when you get to the problems early in the pregnancy and you can deal with them. It'll impact the greatest complication of obstetrics, and that is preterm delivery. Basically, preterm deliveries takes up about 75% of the dollars that are directed towards antenatal care and management of pregnant patients. We've got something now called the Pregnancy Medical Home Initiative, which is coming out of Raleigh and going across many states across the country. And the whole emphasis is to reduce preterm deliveries. And again, it really has to do with getting patients in as early as possible. One of the risk factors we know for preterm delivery is having a woman register after 14 weeks in her gestation. The Cabarrus Health Alliance not only allows patients to come in without Medicaid before 14 weeks and sees them, but actually sends them to a person under our roof to get them an application to get into Medicaid to come back. The private practices, frequently we'll see patients that have come in, they're getting their services from us, they transfer all their records at 16, 18 weeks because they've gotten their Medicaid card. because now they can get into their private practice with their Medicaid card. But we don't discourage that. We encourage them to come to us so we can get that care started early, because that's where you really impact the bad outcomes, especially the preterm deliveries.
Okay, so let me make certain I understand correctly.
Yeah.
It creates more of a risk if a person has a problem and then shows up on the medical door saying, I've got a problem and I need help.
Yeah, that's
Okay.
right. Yeah,
And
I would agree.
if there's no clinical services, they're going to show up at the emergency room more than likely.
Yeah, well, emergency room, it's OB triage or the
Okay.
emergency room.
Okay.
Yeah, those two places.
Now, and if there's an emergency or if there's an issue, that's certainly going to drive up the cost of that visit or that treatment.
Absolutely.
Okay. Now, from a county side,
Yeah.
the baby's born preterm or born term, okay? If there is no prenatal care, or if there's very little prenatal care, how much of a financial impact is that on the county as that child is growing up in this community?
Well, I think that, there's federal subsidies to go to the hospitals for babies that get born premature, and depending on whether they're covered or not, and I don't understand all that, but that certainly impacts that. The charges, of course, are going to accrue over a lifetime, because the latest and most contemporary research being done on the impact of gestational care, that is antepartum care, is that it contributes to chronic morbidities, which takes up 75–80% of the healthcare dollars. The patients who don't get care when they're pregnant have babies that have a much higher risk for developing diabetes, hypertension, and other chronic conditions. So does it impact the county? Of course it does. As these kids get older, they've got chronic diseases. Now we're treating a disease instead of having potentially prevented it by managing it during gestation.
If I could just interject something, I think you got social services issues, you've got issues in the school system in terms of the increased cost of special needs children. So it's not just a medical thing. There are a lot of other county dollars that are going to be spent on these kids.
Now, Mr. Phillips, I got a couple questions for you.
Surely.
If my math is correct, isn't it that Northeast Medical Center had $43 million revenue over expenses last year from Cabarrus County alone?
I really am not sure of that. I actually haven't seen last year's figures for
Or
the
2 years
hospital
ago?
or from the system. I don't know what the hospital, I'm like 6 tiers down from the administrator, so I don't get to see a lot of those numbers unless I go digging. And I've never seen them for the hospital itself. I know that CHS did very well in 2010. As for last year, I haven't seen those figures.
What do you mean very well?
They had a 7% positive operating margin in 2010.
What does that mean in numbers?
$400 million.
$400 million?
That's 35 hospitals.
Okay. Dr. Pilkington, how much money does Northeast Medical Center give to the Health Alliance for prenatal care?
They have contributed a resident. After last year, when this board asked that we look at every possible way to cut that budget, we got them to contribute a resident to come to our clinics.
We have actually an attending physician with 2 residents every Friday for a half a morning that registers new OB patients.
Okay.
So they register maybe 6 to 8 new OB patients. They also come once a month to procedural clinic for the family planning clinic, where they put in IUDs and various other birth control measures. And they contribute a resident, which is really a 50-50 deal, because they get taught obstetrics while they contribute. And that's what their contribution is. That's what the hospital
Okay,
contributes.
so you teach them how to become a good obstetrician.
Hopefully.
And you do not,
Hopefully.
we do not get, the Health Alliance doesn't get compensated for that teaching.
Well, the additional half-day once a week was in addition to that resident contribution. And so they come in and perform 4 hours of free service to register new OB patients, and once a month for half a day for the family planning.
So 48
That's over
hours,
and above.
48 hours a year.
Yeah, that would be, if that calculates out right, yeah, it would 4 hours.
4 hours a
week.
month, 12 months, 48 hours.
Yeah. Well, oh, yeah, but that's for family planning. It's 4 hours a week for obstetrics, so that'd be more like.
208 hours.
Yeah, about 200 hours, yeah,
Okay.
yeah.
Dr. Baker, you're talking about nutrition and preventive treatment. How does that translate into assisting the county in future years of that child?
Well, if we can have children grow up and take care of themselves and be healthy, eat correctly is one of the most important things. Get exercise every day, as you know. Don't do other things to your body that harms you, like smoking and drinking. We try to teach them that, and in WIC, particularly good nutrition, coupled with exercise. That prevents a whole host of diseases down the road. Probably number one, if we're successful, is reduce the incidence of obesity. That reduces type 2 diabetes, and they speculate that this will break the bank 20 years down the road. Half the population is going to have type 2 diabetes if we don't quit getting fat. And so this just becomes a burden on the county as people develop these chronic diseases. Somebody has to pay for it.
What are the costs as clinical services? Round numbers.
And you're talking about from the county contribution?
Yes, sir.
About $400,000 a year.
And how much is the rent?
The rent's about 200,000+. So it's
And
about six.
what's the plan for that monies to be used?
That money would be used for operating. We're moving into a facility twice the size we're in now with a lot of expenses that we haven't had before for taking care of the building. So all of that will have to come out of other operating expenses if that rent money is reduced or eliminated, either one. So we're looking at some of the basic services we have, like vital records, environmental health, and other things, because we can't keep the same level of service. You know, the point that Mr. Phillips made in the beginning, which we go through every year, but I never really am sure that you understand exactly the impact of that. But when you froze our per capita, and we agreed to that at that point in time, it means we lose money every year. We had to cut, for example, all of the county employees get a 401k. We had to immediately take that away because we couldn't afford it. We had it as county employees in that time, but that several $100,000 cost was something we couldn't do. And we've done that, and that's just one thing I point out. We've cut, because when you have less money every single year, it's just a matter of where and we can only get money from 2 or 3 sources, the feds, the states, or the locals, and that's the only sources. And as you all also well know, the states have cut back public health monies for the last time was pre-Reagan that there was any increase in public health monies from the federal level. So there's just never been an increase in public health monies. But again, and I wanted to make sure I emphasize this, we haven't had to do that because of you. Your contribution has made that not a problem for us in Cabarrus County, but by the same token, that money has made us as successful as we are because we have that range of services. When you're asking Dr. Suda that one question, all you have to have, and you have it, Dr. Suda, I guess probably once a month, a baby born who had no prenatal care, no services, who comes in weighing 2 pounds, 3 ounces in the hospital for 60 days, the bill for that can be over $1 million. And in many of those cases, that's taxpayer money because they have no source of reimbursement. And another point you always need to remember, and I harp on this all the time, is that everybody thinks of hospitals and doctors as private care, but guess where 60% of the revenue for their services come from? The taxpayer through Medicare and Medicaid. So when it's 60%, almost every hospital and provider services are the government supported. So we are no different in that sense as a public health department, but I think the point I'm trying to make with that is that we're all of this in this together, and if one part of the system is pulled out, and this part is very important, this women and children part of it we have in this community, then the impact can be devastating. And like I've said before, I really pride myself in the fact that that infant mortality rate is where it is. I'd sure hate to open up the data and the reports I get 3 years from now and see that we had 20 infant deaths because we didn't have this service. And I'm sure you wouldn't want to see that either. So.
That's all the questions I have, Madam Chair. Thank you.
Could I make one other comment? The hospital has contributed, Mr. White, to this process, and I think it's important to understand that about 2.5 years ago, they begun a process of trying to get call coverage for the obstetricians who were lamenting the fact that they were spending a lot of time in the hospital and working very arduous hours. They were also contributing by covering the call coverage for our indigent population. It was a group participatory process involving everybody. We worked a few years on that. When I first got here, we kind of went down that path, and we got it to be functional, but the physicians were very, very beat up from that system. They looked around to say, how can we put together a call coverage system for all comers that would be more effective and less problematic, less burdensome on the obstetricians? And they came up with an OB hospitalist program. And the OB hospitalist program was begun 2.5 years ago. And I think it's pretty close to revenue neutral, but don't quote me on that. But it's supposed to be revenue neutral to possibly even a moneymaker when you get above 2,000 deliveries a year in a large hospital. And we have about 2,800 to 3,200 deliveries a year. The OB hospitalist program is, there's an OB obstetrician in-house every day, 24 hours a day, 7 days a week. There's 4 of them, and they rotate. There's actually a 5th one, but he's only there for a couple days a month to make the vacations and everything work out. That has been a significant contribution to the care of the indigent in this community, because I have a ready source of backup 24/7 in the hospital, whereas before I would have to go out and seek assistance from private practitioners who were very busy doing 10 other different things. And of course, they weren't happy getting, you know, a 34-week obese, hypertensive, diabetic patient who was bleeding and going to the hospital. So having the obstetrician on 24/7 is a big contribution to really stabilizing and sealing the acute care component, backup component, to a comprehensive obstetrical plan, which is what's going on right now in our community. So they have contributed that, and to their credit, it seems to be working very well, and everybody's very happy with it.
But my point is, you're delivering a tremendous number of babies in Cabarrus County. And you said that when you hit about 2,000, that's when it's a moneymaker for the hospital.
It is.
You're hitting 2,000, right?
Yes, we are.
How much of that extra money is going back to the Health Alliance saying, you know what, you're a moneymaker for us, and we appreciate it, and we're going to help you defray those costs?
Well, a little bit, you know.
Is $400,000 coming back from the hospital
Yeah.
to the Health Alliance saying, you're helping us, and we're helping you you're helping us by keeping people out of our emergency rooms and out of our OBGYN clinics, and you're carrying that burden. We as a hospital appreciate that, because you know what? We made $400 million. Here's $400,000 because you're keeping this out of our rooms, out of our emergency rooms, out of our delivery rooms. Are they doing that?
No.
Okay, that's my point.
Yeah. We're looking for stakeholders to take, you know, cooperative teamwork approach to this, because that's really how it works out best. I'll be the first
Yeah.
one to step to the plate and say that. Absolutely.
Thank you.
Commissioner Meismer.
I know you touched on this a little bit earlier, but could you explain how the Healthcare Reform Act's going to really change? Will it change any, or what will change some of the processes, or do you have any idea of how that's going to affect the Health Alliance and its services? Or
Who wants to speculate on that? Fred?
I'll speculate on it. I've done it several times already. The increase in the number of covered patients is going to, as Dr. Baker indicated, is going to be a problem for the entire nation, because we have a shortage of pediatricians, we have a shortage of family practice physicians, and all the numbers, but admissions to medical school indicate that trend is going to continue, whereas our population is increasing, and now we're going to have more people able to get care. Primarily right now, people do. When I grew up very poor, and the way that my mother approached it was, if you really, really needed to see a doctor and we absolutely have to go and you're not close to dead yet, we'll go. And that's, seriously, that's the way she approached it. But that's the only way we went to the doctor. That's the way a lot of our patients approach it at this point in time, too. They come, they don't really overuse our system. I think Dr. Baker will tell you that quickly. They come when they're sick and they have to. What you'll see with the Affordable Care Act is if it remains, especially, and I hope it, like Dr. Baker, it does for children, that they will be able to get care that is not episodic, is what we call it, every here and there, not in an emergency room, but that they're coming in and they're getting care so that when they get that ear infection, instead of having to show up at the emergency room when it's serious shape, they're showing up to see Dr. Baker tomorrow when it's just developing, and he can do something with it before there's serious ear problems later from it. And I hope that that's what's going to happen. So long answer to your question, Commissioner Meismer, I think we'll see a large increase in public health department demands. Now, I will say one of the things we're working on, and we haven't touched on that, is that we have in this community what is known as a community health center. It's a federally qualified health center operating in McGill that receives higher reimbursement than we do for primary care. It has been fledgling, I guess is the best word, and floundering. They have come to us as a board and asked our board, and Mr. Phillips and the board agreed to take over the management of it. The primary reason we did that was because we see that as a transition for our patients. We can't do it today quickly, but we see that as a way to transition our primary care patients, these women and children, into a service that gets a better reimbursement. They also get almost $1 million a year in federal grant to do this. So they're getting money we're not getting to provide this care, but they're very small and have been in a lot of financial difficulty so far. We think we can pull them out of the financial difficulty with better management, and we also think we can start transitioning those patients from public health into that system. But if you ask me, can I do that now? No, I can't do it now because they don't have enough physicians or providers. Can I do it in 6 months? No, more probably like 16 to 20 months that we can come back to this board and say, yeah, we've transitioned out the primary care component, so we're not asking you for your $400,000 contribution anymore. We've been able to do that. And at the same time, we've been able to do what these gentlemen were saying that was so important to this community. That system stays intact, so everybody has a primary care home, and we still have all those good numbers that we're looking at. But right now, and I know Commissioner White says this, it is true that we don't get that kind of support from the hospital that I think some of you would like for these services, but that's been the case since I've been here. And I've been here a long time. So and in fact, in the old days when I first came here, you used to give the hospital several $100,000 a year for indigent care that you don't do anymore. So the systems have changed over the years. But what we have to really come down to in terms of, I think, as a community and as a board of commissioners is that by statute, public health is your responsibility. It's one of the few things you're required to do. But secondly, it's the right thing to do. We do a good job of it. We take really good care of these patients. You won't find a better pediatrician than Dr. Baker. I've known him all these 30 years. Dr. Suda has some of the best OB/GYN training in the entire country. His residency is in one of the best schools in the entire country. We give these folks excellent care. So we think as these numbers grow, we can transition them in the community health center, and we can handle them. And all we're asking you to do is work with us to this point of time, get us to that point so that we don't end up suddenly dumping the systems, because it would be nice on the system, because it would be nice to say the hospital's going to suddenly absorb them. No, what's going to happen is, Dr. Suda said, when they ask for the money on the first visit, they go back out the door. Then they show up ready to deliver a baby. They show up at 10 o'clock at night in the ED with an ear infection. That's the way the system works. And that's the way it used to work in this county. And this gentleman sitting to my right was chairman of the Board of Health long before I came, I guess, wasn't it? And he spent a great deal of time building a system that didn't allow that to continue to happen in this community. And for that, we owe folks like him a great deal of credit. But I hope we don't go back to a system where we say those people who are the least advantaged in our community have to go wherever they can to get care whenever they can, when we have a relatively inexpensive, I think $400,000 of your money a year is a relatively small contribution, and we haven't, as again, asked you for any more over the last 15 years. So.
Whenever you mentioned earlier about some of your clients and some of the issues they have as far as depression or malnutrition, do you see success rates whenever, as they continue to come to the agency, or is it?
Well, you know, I can't quote you that. So, I mean, I can't tell you what the statistics are on improvement in depression and weight, maternal weight gain, things like that. But I can tell you this, that under our roof, we have WIC in our building. And WIC is not only just for women and infant care, but it's also for nutritional support. Whether they qualify for WIC or not, all these ladies are nutritionists, and we frequently send patients across the hall to go over there to get, you know, information on how to manage their diabetes, you know. In fact, they're all scheduled once they have a diabetic diagnosis to have a nutritional consult. So we have services under a roof that you will not find under any private practitioner's roof. I was in private practice, I worked for a hospital and private practice transition from 1990 to 2002, and I couldn't get social services to work with me because it was too expensive. In the state of Washington, they just didn't have that service available. And I would be sending 15-year-olds home with new babies, and I didn't know what the heck was going to go on. I didn't have time to deal with it. But in this county, it's blessed with, you know, these kind of services to the point that we've got clinical social workers, or we've got who also double as depression counselors. We have WIC, who also double as nutrition counselors. We've got all of our staff is specialized for indigent care. We have order protocols such that they don't have to come to me for everything because they just know how to manage that population very well. And I'll shorten that answer also. Even though I can't quote the statistics on improvement, I know I have services and resources to address virtually any problem that comes into our clinic. And I know personally, of having been in, you know, at a site where for 12 years I didn't have that, and I'm a much happier camper. I love working here, love it. It's a pleasure relative to working in an environment where you don't know what to do with these patients. You feel terrible. You can't write a prescription to take care of the psychosocial service needs that these patients have. It's overwhelming, and it's a real blessing to work here.
Okay. And, you know, first, you know, I want to say I appreciate everything that each of you do, and I certainly know this is critical services for the county, and, you know, I know this is, you know, important. Each one of your roles I know is, you know, very important, and I understand what you guys are trying to accomplish. I understand the mission of this, and I certainly applaud all of your efforts and everything you've done for the county. But Mr. Pilkington, you had mentioned that our contribution's $400,000. On my information, I have that the county contributes a little over $4 million. So
$400,000 for clinical service.
right. Okay. So where does the extra, you know,
Well,
$3
there-
million?
There's certain things you're required to do.
Okay.
A county's required to have a public health director.
Right.
Which is me. You're required to have environmental health. You're required to do birth and death certificates. You're required to do communicable diseases. You're required to do, I don't know, vital records. Those are the requirements around that. And then you're required to have a certain list of personnel in each county
Right.
to provide those services.
Okay. So we do contribute more than 400,000.
Yeah, but my point,
was all
excellent
about-
point. Yeah, what last year this board said is that they wanted to dedicate only 400,000, or roughly that amount, to clinical services, and that they wanted a plan to get rid of that essentially last year. That was what the board instructed us. And so my impression from that was that that was the money that was on the table.
Okay.
And we again understand that, but I said we appreciate it. That's what, we don't rank per capita that high because of the 400,000. It's because of the 4 million that you talked about
Right.
that we get.
Well, and part of that 4 million is programs that are mandated, but only mandated to a certain level, correct?
That's correct.
Okay. So
They're only
that's-
and one of the things you have decided as a board last year is that you want first dollar coverage to go to all school nurses. We have, you know, again, I don't need to educate you on this, but for those listening the first time, we were the first county in North Carolina to have a school nurse in every school. We actually had a school nurse in every school in 1940, but went back and found that out recently. But we now have it again, and that is a huge expenditure. It's a combination of a lot of us, but mostly the county commissioners' money through the schools as well as the health department. But we are unique in that, and since you've asked for that coverage, that's almost $1 million of that contribution right there.
And Mr. Phillips, you had mentioned earlier that the Health Alliance was courtesy of Kannapolis. Could you explain that?
The city of Kannapolis issued a bond for capital improvements in Kannapolis, a water line, some road work, and the Health Alliance building. And I don't know what the total bond issue was, but we got some $8 million out of that,
Yes.
that they used to build a building which will revert to us in 17 years. So we will have ownership of it at this point because they paid for it, they own it.
Well, the county's making a contribution to that money financed. So, you know, I would argue that the county's paying for the building, not the city of Kannapolis.
Well, that can be parsed a number of ways. My understanding is that the county's authorized them to take tax revenues to cover that bond issue, but the bond issue is by the city of Kannapolis, so, and they're the owners technically.
Well, technically, however, the county is paying, what is our, Pam, do you know off the top of our head, our payment?
We're paying 50% of the debt service. It's about $1.4 million,
Okay, a year, correct?
starting in 2013.
Okay, so each year it's 1.4 million, so, okay. So I just want to clarify that the county is paying for that portion for the building. I wanted to
We
make sure.
appreciate it.
Yeah, I just wanted to get that clarified. Just want to make sure there was no confusion on that. And then also I wanted to ask Mr. Pilkington, you said each year that our county contribution does not increase, that actually you're taking a cut each year. Are you talking specifically for the clinical services or for the Health Alliance in general?
I'm talking about the Health Alliance in general because the fix to begin with was a per capita amount of money. So it only went up based on, if population went down, we lost money.
Right.
Population went up, we gained only what was there in population. But if you compare that to the cost of inflation, we never met that any year. Your additional contribution each year never even covered our health insurance cost increase, much less anything else. We would absorb more than that in every year, so we were basically every single year that's gone along, and in fact, the last few years, you haven't even kept the per capita going. So we've actually gone backwards about 4 years.
Okay, but your budget has increased each year, correct? Maybe not from the county, maybe not county contribution, however, your budget has increased
Certainly, yeah,
overall.
we've gone heavily after grants. We have several federal grants, most recently a huge CDC grant for community transformation. So we've got lots of grants out there.
Okay, that's good. I just wanted to clarify that we're not cutting each year, that you're also seeking additional funds from elsewhere.
Definitely.
Okay. And, you know, I certainly understand the whole idea of the preventative care, and I think that we've come to a critical point in our society and community where, you know, we're going to have to decide whether, you know, healthcare is a right or a privilege. And, you know, I think that's where all of this argument is boiled down, and especially with, you know, the Healthcare Reform Act and, you know, every bit of that going on. And, you know, I certainly tend to believe that healthcare is a privilege, not a right. And so that's where my beliefs come into that. But like I said, I applaud everything that you guys are doing and your efforts and what you're doing. However, you know, I have to take that approach to it. And as far as the one more question, as far as the new building with the expenses, the plan is to take the rent money that will not be collected in the new building to use to pay for new expenses incurred because of the larger building. Is that correct?
We would pay we'll be paying for all kinds of things. The power bill will be double what it was before, on and on it goes.
Lights,
Everything.
heat, upkeep, I mean, somebody's got to
Certainly be
sweep it out
more.
at night.
Okay. And just one last comment. I think, you know, with everything being said, and if we could turn back the clock and look back, if we were to take that 1.4 million that we are spending on a new building every year, that would be far more of a contribution to clinical services and would accomplish a lot more of what you're trying to do, rather than, you know, here we are discussing whether or not we're going to, have to cut a budget or not. You know, this is something that we could have, you know, I think that was kind of short-sighted to look at that, to see that, we're going to get a new building, however, a budget may be cut. And, you know, if we could have used that money towards the services, we could have accomplished a lot more with that money.
I would agree with you. The reason that we were looking for a new building is because the county commissioners said they wanted us out of the Kmart building so they could
Correct.
move social services into there.
I understand. And that was, that was obviously a decision made before I got here. But
Okay, thank you. Commissioner Carruth.
Yeah, just to clear up something I think needs to be cleared up, and I think it has to do with the 1.4 million, and it not just to get it out of the Health Alliance building, but it was also the fact that when we were negotiating with Kannapolis on the TIF financing, which is a totally different issue, this board decided that we came forth, and that's what we wanted to see built, was a new Health Alliance building as part of that TIF package. I don't think we can't say that the $1.4 million, because we're spending it on the new building, would have been spent on clinical services, because that whole thing was tied up in the TIF arrangement. The TIF arrangement is what the $1.4 million goes for, because we agreed that we would provide the increased tax revenue from the TIF district, which has nothing to do with whether or not we would give more money to the Health Alliance for treatment, because that money wouldn't have been there if we had not been in this agreement with Kannapolis. So I don't think it was a matter of we chose to build the building rather than provide services. It's just that happens to be the amount of tax revenue that's come in from the TIF, through the TIF and the part of the debt service.
This board made a clear decision of whether or not to authorize that building being built. So this board had a decision to spend $1.4 million on a new building.
We made an agreement with Kannapolis that we would, through the collection of the increased revenue that came in from the research campus, that money, that we would use that money to reinvest it in the TIF district.
Right.
And this is part of the TIF district.
And Cabarrus County was collecting the tax revenue from that research campus for many years before that building was ever built. So where was that money going before?
There was no collection of any revenue because the TIF district did not exist before 2007. So there's been no money collected because there was not, I don't think the values were even established until December of 2008.
So if the money was collected in 2008, then the building wasn't approved till 2010?
I don't think there was any, I would have to have our finance director go back and look and see, but I think that if you look at, I think that was kept separate of where the revenues that came in from the TIF district. And that money, through the agreement with Kannapolis to support the research campus, that money is what has been used for the Health Alliance building and will also help defray the cost of infrastructure improvements in Kannapolis. So,
And I think your point would be that, which has been made a couple times, which is that if any money in the budget is used for one area, if we didn't use it in that area, we would use it somewhere else. And I think that's what you're trying to point out, that by paying for that building, that through this agreement, that if it wasn't going to that building, we would have those funds to appropriate in a different direction. So I think that's where you're going. I have a couple questions because I'm told often that a lot of people, one, watch our TV shows, and two, they look at our website. And our agendas are posted online for everybody to see. So one of the things that's posted is what's up here right now, and it's representation, I guess, of your budget. And I don't know if it's your entire budget at this point. There's 3 pages up there. But a couple things to point out, because I do believe that people will look at this and they might need an explanation. Under the column, which is the last one you can see with what you have up on the smart board, where you have county, those are county dollars where you take county dollars, and that's what our county dollars are going for. Is that correct?
That's correct.
Okay. And then next to that, which if you slide over just a little bit so you can get the far right-hand side, you've got where it's mandated / provide and mandated / assured. What's the difference in those titles?
I can't see that at all, but.
Sorry, it says mandated / provide, and that's the first column.
Okay.
And I presume that most of that is telling us general statutes that where we are mandated to provide those services.
Mm-hmm.
I don't know what assured means.
Assured is such things as maternal and child health. That what the health department and the county are required to do is assure someone in the county provides those services.
Okay.
And if they don't, then the county is obligated to provide those.
Okay.
The provide is that we have no choice.
Okay, and I just want to make sure that when people look at this, they'll understand the differences in those two terms. So, okay, sorry.
That is not general statutes. That's
Sorry.
North Carolina Administrative Code. So if someone looks up a general statute, they're never going to find 10A NCAC 146. That's going to be North Carolina Administrative Code.
Okay, thank you for that.
That's
It's nice
correct.
to have an attorney around. Okay, so if you want to shrink that back down. So when I looked through this, and I was looking to see what are the things that the county dollars are going for. And we have communicable disease control, which controls the spread of communicable disease in the community by detecting, investigating, and monitoring the occurrences of new cases. The county provides some funding for HIV education, counseling, and testing. And I think you alluded to that.
First county in North Carolina to do that, by the way.
Already?
We're proud of
Okay.
that.
And I will point out for people that listen either here or that look at it online, you can see where there are state grants provided and other sources, fees, et cetera, that you get revenue versus what the county. So you need to look at that too. There are a number of items, programs where you show the county in the negative, which means that you actually make a little bit more money than your expenditure based on grants that you received, showing that you're a good steward of those grant funds and use them to the best that you can.
That's correct.
Okay. Let's see, if I go to the next page, please. We provide funding for environmental health, which you've already mentioned. Enhance the quality of life by implementation of effective and efficient environmental health programs to protect the public health, safety, and the environment. And then, I guess at the bottom of that one, go down just a couple clicks, there you go. IT administration, so services and support, project management, business project analysis, database support and reporting. And then the next page mentions human resources and general administration. So those are things that the county is required to provide funding for your administration of the Health Alliance.
Correct. Or do it themselves. What happened the initial year we began in 1997, the county manager at that time, Frank Clifton, set aside a part of that money that would come from the county to provide the administrative structure as built into that per capita, so that we would, as he said, not fail immediately. So that money's there basically to cover our overall cost.
Okay. And then, as you've already mentioned, was the school nurse funding initiative. On that line, you do have a very small amount of state grants, probably because you were #1 in the state to start that initiative, and at that time, you were starting, I think, a very good initiative, and the state was a little bit later to come back and say, oh, that's really good, we need to do it everywhere else. Since you're already doing it, we're not going to give you any money to do it. You can just keep doing it the way you've been doing it. Would you agree with that statement?
That goes in that no good deed goes unpunished. When the state saw what we were doing here, they got the legislature the state public health department to agree to provide money for school nurses throughout the state, 1 or 2 per county. But they said Cabarrus gets none because you have one in every school.
I had an interesting discussion with Carmen Hooker Odom about that, and she doesn't argue real well. She's tough.
But what we did is we went back to them through our legislators and said, that's not fair. So they decided to fund at least one of ours. So we get one nurse funded through the state, whereas most counties are getting 3 or 4.
Okay.
So.
Also, in that line item, you have miscellaneous amount. It should be noted that the county provides funding through the school system. So some of your nurses are funded technically by the county through the schools. The schools send the money to the Health Alliance because they are employees of you, because not only are they in schools, but in the event of a major health emergency in the county, you would call on those school nurses to shore up your staff and to address if we had any major outbreaks of some kind of disease in the county, the school nurses would be called into action to assist with you with.
Exactly. Yeah, I wouldn't want to scare anyone, but I think you've heard me say this before. We are aware that smallpox vaccine or virus exists out there somewhere. It escaped the Soviet Union in those days when the Soviet Union collapsed. We don't know where it ended up. So because of that, we have a large, complex network of programs ready to handle that if anyone introduces smallpox in the U.S. But just to give you an example of what that means in Cabarrus County, we have to vaccinate the entire population in 72 hours, or 50% of our population dies. It's as simple as those numbers. So those school nurses and everyone else, we have them all on a roster. Every veterinarian, every pharmacist, anybody who's got a needle in their hand, maybe all of you, we'll take you, and we have a plan to take in the entire Concord Mills shopping center, park everybody at the racetrack, close off the highway, close off the interstate, bring them in, because it'll be that massive. But all that's in place. So Mike will tell you from his days as emergency operations over that is one of his areas. You'd be surprised for what things that happen, but those people you talked about, not only in communicable diseases, but in the school nurses and everywhere else, really come in handy. Just a few years ago, on a Super Bowl weekend, and I think you remember this, Commissioner Poole, we had a young man at Food Line who was culling all the produce with his bare hands with hepatitis A. And when it came out that we had to vaccinate 1,800 people in 2 days in the middle of an ice storm, and we did it. But it was, and it can be as simple as what we do every day, but it can be as complex as suddenly 1,800 of you needing a shot in 48 hours. So that takes a lot of management. So.
Yes, you're correct. I am familiar with that. My family and all, all of my family members and I lined up and.
So you remember that ice storm, don't you?
I do remember getting a shot in the posterior.
Yes.
It is, we have, as you know, because we do fund school nurses and we told you last year that that's a very important initiative that we won't preserve because we feel very strongly about that. I do have I think that we all do this at different times. We like to point out things so that, again, when the public hears our meetings, they can get a better understanding of what you do and any of our departments that present. That's kind of one of the things I think that we as commissioners should do. I have a couple questions for you. One, long before I was a commissioner, the ADM amount was set up. Is there any way for you to tell with the growth in population, and we have seen obviously a great influx of people in Cabarrus County, can you tell if there is a higher percentage of usage from those people, anybody that's moved in the last 10 years? Is there any way for you to track to see that if we've grown, and I'm sorry, I don't have the numbers off the top of my head, if we've grown 50,000 people in the last 10 years, that 50% of those people show up at your door, or 10% of those people?
We actually do track that, and the numbers, we're always run a little higher. So for the increase in population is 12%, we see about a 14 or 16% increase. And I think some of that is transition. At one point in time, we had a lot of people moving from the north. And in the north, public health services are open and available to everybody, irrespective of ability to pay in many cases. So they assumed the health department was theirs to use, so they started showing up, and we had to educate them and explain to them that that's not the way we do it here. We have an eligibility way of going about services. But we then also saw the Hispanic population increase as well. And as you all know, they transition through working without insurance to working with insurance and so on. So a lot of these people do what Dr. Suda said. They work their way into our system and work their way out. But the numbers generally run just a little bit ahead of the population increase. But that's also a factor in terms of what I was talking about with the budget. What happens when you get the same service per capita every year that you have, we also see a lot more patients and continue to see them.
Yeah, another aspect of that, at one point, the Hispanic population in Cabarrus County was listed at 500 by the state, and there was a Spanish language newspaper that had a circulation of 10,000. So there was a bit of a discrepancy, and those, for better or for worse, are people we do serve.
In 1990, we delivered 10 Hispanic babies in Cabarrus County. We've been delivering 200 to 300 since 2000, so.
A question I have on this sheet is there's a column called Number of Recommended Positions for 2012, and some of those have numbers in there, and then there's a running total that I can't quite track. So how many staff members are you projecting to grow? Are you projecting to grow staff members in the next year? And if you are, how many do you think full-time equivalents are you needing to add?
In full-time equivalents, we're probably looking at, well, hopefully there won't be any more schools, because that always hits us with another school nurse each time the school comes online. But fortunately, the Board of Commissioners have absorbed those costs for us as we have every new school. But what we're seeing is dental is, you've heard me mention before, we have fewer dentists per capita than almost any other county in the state. This is a very, I guess, dentist poor, for lack of a better term, county. So public health has taken that on, and that's one service where we're revenue neutral. We don't lose any money on it. We set our population basis so it's 71% Medicaid, so we generate enough money to pay for dental, because children get Medicaid dental, almost every one of them who are eligible. They don't get it in other services. So we can make that service work. So we'll add about 6 to 8 dental positions in the next couple of years. The other service that we need to look at, and I probably need a great deal of feedback from you on that, is environmental health. The state used to give us tens of thousands of dollars for environmental health, and each year it's been cut back to the point now where it's just a couple of $1,000s total. They write all the rules and regulations, tell us we have to grade every restaurant every quarter, and give us no money. And as y'all heard me say this last year probably, and the year before, to the point where you're sick of it, but all you have to do is drive down Concord Mills Boulevard and see how many new restaurants there are every time you drive that street. And we've got to grade every one of those restaurants every quarter, and we have the same people we had 5 years ago. Probably have the same people we had 9 years ago in environmental health, so it hasn't grown at all. Now, what do? You grade spending a lot less time than you did in the restaurant before. That's the only choice you have, or you do what Mecklenburg's done, and Mecklenburg just simply chooses to ignore that and not grade them. So if you go to a restaurant in Mecklenburg County, you look up on the wall, you'll probably see last January's was the last inspection. Now, that's the choice. But we continue to follow the state requirement that we grade every quarter. So, and we have on our positions up there to add an environmental health specialist this year because we think we need to be out there grading your restaurants for you. So, simple as that. And you tell us that sometimes too, so, with what you see.
Okay, and we have talked about that as a group, that we think it's wrong for you to send all that money to Raleigh when you're the ones doing the work. And we've discussed that with our legislative delegation, that if you do the work, you should be able to keep the funds.
Yeah. And
we would agree with you on that.
We even review the restaurant plans for a new restaurant, and they keep 50% of the money at the state level. We do the review. So why do they keep the money?
That was one of our legislative goals, and also another legislative goal was to allow the health department that if somebody wants to pay for services, whatever that amount is, they should, if they want to pay, they should be able to pay. I mean,
Yes, which is also another good point, because we do have federal and state requirements that don't allow us to take someone's money when they're handing it to us. And we have been, actually, the feds have come in and told us to stop doing that with an actual on-site visit. Do not take their money. So,
And we agree that if people want to pay, even if it's a modest amount, I think sometimes for your own self-esteem or pride, you'd like to be able to pay what you can pay. It may not be the entire cost, but you'd like to be able to pay something. And that's, I agree with Commissioner White's the one that brought that up, that that's a little bit ridiculous, that if they want to pay you $5 for something, granted, it might cost a lot more than that, but still, there's some self-esteem issues in there of being able to pay what you can pay. So, let's see. The other question I had was, not to belabor it, but back to the rent. Just to verify, we funded you rent, and you paid rent back. Is that correct?
I can find no record of that happening, and I negotiated the original arrangement with Mr. Clifton, that no rent money was ever, unless you guys have a record of that, I have no record of rent ever being added into it, going back to 1997. So
Okay, do you pay us rent right now?
we are the only health department in North Carolina that pays rent for providing public health
Okay,
services.
we need to, then I guess that we need to track that down, because my understanding was that on the rent issue, that in order to have a paper trail, if you will, that in the funding that we gave you, we funded you whatever the amount is for rent, and then you turned around and sent that back to us. And we've done that a couple ways. For example, with the school system, we're paying for the buildings. The county, funds the school buildings. But they still have to have plan review and get their permitting done. And they still pay it. I mean, we're paying it for them to pay it back to us. But we want to make sure that that cost is identified, and that's the reason that we're doing that. And I was always under the impression that we funded you the rent, and then you funded the rent back to us. So
The arrangement that Mr. Clifton and I had originally was that they would fund us for IT, the financial, they would carry some of our munis expenses for a couple of years, and those things were paid to us separately to take care of those costs. I can find no record of rent being built in, but I will also say rent has gone up over the years, and nothing extra has been put in our budget to pay for the increased cost. And you can never document any increase for the increased rent cost.
Okay.
So,
Do you currently pay your utility bill at that building, or how does that work? I don't know.
yes, we pay our utility, don't we, Tammy?
You're metered for your building?
Yes.
Okay. Then I would say that, at least for me, and I know that you haven't, your groundbreaking is soon, next week, I believe. Is that ribbon
That's
cutting?
correct.
And
Dedication.
Friday the
Dedication.
13th.
Friday the 13th, a very good day.
We hope everybody will come.
What time?
11 a.m.
11 a.m. I would presume in your budget process that you have attempted to identify those costs of operating the building.
We thought it was coming from the rent until
So-
a couple of weeks ago, so.
Well, you still need to identify the cost. I mean, you still would
Yeah,
need to break that out and
yes.
identify what your costs were gonna be.
Yeah, now we're
I
trying to
think
identify where we're going to pay for it from.
I would like to get the information from you on what your actual operating costs for the building are, and additional financial informations of what that rent amount is, and to see how that balances financially. I'd like to see some numbers. I'm not disputing, I mean, I'm telling you what I was always told. I'm not disputing your side of the story. I need more facts to look at, and look at those numbers and see what those numbers are. As you know, and as I think everybody knows, we are trying to make as many cuts as possible for this year. We've not identified specific cuts at this point in time, because we really won't do our budget process until May, when we really get into that. But we're having a number of entities, whether they're our departments or not directly under us, come and try to explain your budget, so that, one, we can educate ourselves, and two, we can educate the public, and see if there's any other gaps in there that we might need to identify. Commissioners, do you have anybody else have any questions?
I was just going to add, because I think I guess we're probably starting to wind down, and this is just Bob speak. You know, Bob, when I say something, sometimes I just throw an idea out on the table, and I don't know whether, and maybe open a can of worms here, but do we, given the fact that the arrangement was set up with the Health Alliance, what, 95, 96 timeframe? Yeah. With the funding per capita locked in, and then there's been so many changes, including now changing the whole facility of where they're housed at, is it's time to look at a new method, a new formula, a new algorithm to be used for funding that would, you know, because of the changes we've seen in the community in that 15 years since it was first done. I mean, because of the fact that here is that, you know, it's flat, then we're looking at the rent. Was the rent included, not included? Do we need to look at how do you capture all the expenses, and how do you do a true thing so that is there, you know, do you put any kind of an adjustment in there based on some kind of index that would ensure that we would be maintaining the proper level of funding? And I'm not saying necessarily it would go up. It may actually would go down. I mean, but, you know, I'm saying it's just a way to, a better way of indexing that versus just a flat per capita that's frozen as it has been for 15 years. And, you know, an account where you have it, you know, you're going into a new building, you've got new expenses, you know, you continue to get grants, there continue to be money that's withheld from the state, or new grant or new stuff, funding streams coming from the state. Is that something maybe to look at? I don't think we're going to get it done in next month, but I think it's something that certainly something to start looking at maybe.
And we do have documentation over the years of reductions in our per capita. We used to do the jail nursing, and when we stopped that, there was a reduction in the per capita. We used to do the employee wellness program. That's why I say I can find nothing about rent, but I can find deductions from the per capita along the way based on services that we no longer provided to the county.
Commissioner Meisner? You're okay. And my only point about the per capita is, I think we were pretty honest with everybody last year, saying that best case scenario this year would be flat funding. The schools will argue with us that they continue to get students. They can identify exactly how many students are there, okay, as part of the population. And I've also said, you know, 10% unemployment is a terrible thing. We also need to look at that in light of the fact that our county has grown tremendously, and jobs have not been able to keep up. I mean, if we hadn't taken in so many new residents, then our unemployment rate would be lower than it is. And so that's why I was asking you about, you know, how many people you are serving. It's one thing to say that the population has grown, but if, and I've played devil's advocate at this point, and then we'll move on, if the growth in the population was, you know, the majority of those people don't even know that you exist and haven't found your door, then you would need the funding in the event of an emergency, but on an operating basis, do you really have that impact? And that was, I don't know how you can really judge that and see what the growth has done versus just an ADM basis. You know, I can see that for schools because, like I said, schools can literally count heads and, you know exactly how many students are in there. And they're used to operating for a year, sometimes two, without the funding for the students that they literally have sitting in a chair. And I know that your services, your demands have increased. I agree with that. I'm just trying to judge it based on the population growth. And is that truly the best number to use, an ADM funding for you? Or is there, as Commissioner Caruth said, is there another way that we should be looking at it in the future? And I agree, we can't get that done in another month. I don't think we can ask you to do that. You might have some staff members have, you know, some problems. But I do think that might be something that we need to look towards. And the last thing I want to mention, and this is because it was mentioned to me, I think that it would be nice, and I'll just use that adjective, if your nurses could purchase their insurance. I know that they're not full-time. I understand they're not full-time. I'm not saying for you to provide it for them because they're not full-time, but to give them the option through payroll deduction to be able to purchase the health insurance, because you have nurses who are frontline, and in the event of smallpox are going to be out there dealing with that, and yet they don't have insurance that they don't have their own insurance, because private insurance can be cost prohibitive as somebody that used to have their own business, and if you can't get into a group plan, sometimes that's an issue. And I would like to ask that you look at that and see if there is any way that, and I don't know what would hinder you from that, but if you could allow the option if they wanted to opt in and they had to pay for it.
And I wholeheartedly agree with you. We do it every year. We assess it. The cost of providing that insurance to that extra population drives everybody else's insurance up. And it hurts because we're a healthcare entity, and here we have 42 nurses with no health insurance. And we used to lose 3 and 4 a year because, for example, their husband would lose his job and they had no health insurance suddenly, so the nurse left. We're already up to 10 this year. So we've lost almost a fourth of our nurses during this year because of that particular issue. But again, we don't have the money to pay for it, their health insurance.
And I'm not asking you to pay for it. If there was a way that you could come up with that
Yeah.
they could pay for it themselves, the ones that chose to do that, I think that would be, I think that would be fair for the
Yes.
nurses who are your front line, because they do a lot of work. I have
agree.
firsthand knowledge of all the work that they do, and they do a lot of maternity care for students that, you know, they don't get to you as often, but they definitely can go see a school nurse if that's the case. So,
I
thank you
assure
all
you
very
that
much.
will be on our agenda as a board. And if I could just make 2 very brief comments. I am so delighted to be a citizen of this country and to have the opportunity to appear before our elected citizens to exchange ideas. And you mentioned educating the public, and anybody out there, we have a budget hearing in June. It will be advertised. We would be delighted to have you show up and discuss your thoughts on our budget. Please turn out.
And if you will make sure that you email us and let us know when you set that date, we will be more than happy to announce it at our meetings and make sure that we can, at least this way, we could get the word out that people can talk to you.
It's been going on 15 years, and I'm still waiting for the first person. I would be delighted to discuss our budget with members of the public.
Well, we appreciate that offer. And if there's no other comments, we really do appreciate you coming. I mean,
Thank you
I think
very
this
much.
was very educational for me, and I'm sure everybody else in here.
Thank you for
Thank
being
you all
so
very
generous
much.
with your time.
Dr.
Thank you
Baker,
very
it's
much.
always a pleasure to see you. He was
Thank you.
quite helpful with, I think, both my husband, probably me, and I know my children. So
Thank you for
Thank you
having
very
us.
much.
thank you all very much. Okay, we're going to go back to our regular lineup in the agenda. So the first thing up is Cabarrus County Schools and Kannapolis City Schools. I know we have Mr. Whitkey here and Mr. Crabtree coming around to talk about the QSCB projects.
Let me go first. Sure. Okay. I'll start off. We've had quite a bit of activity in the QSCB projects since we last met with you. I can't say that it's all been good news. We have had some issues with the bids coming back. We've bid 3 different projects. One being a chiller at A.L. Brown High School, the other being some control work at Fred L. Wilson Elementary, and the other being control work at Forest Park Elementary, Jackson Park Elementary, and Woodrow Wilson Elementary. The bids came back over budget on all those projects. We were able to negotiate with the manufacturer for the A.L. Brown project, and it did come in, we were able to get that back in under budget. As far as the controls at the other sites, they were substantially over budget, and we're just not going to be able to, there's no value engineering to be done there that's going to bring that back into budget. So very concerned about that. As we're going into our next bids, we have a pre-bid meeting tomorrow for the lighting project at A.L. Brown. We're going to be opening bids next Monday for the roof at KIS, and we'll be opening bids shortly thereafter for the HVAC at KIS, Kannapolis Intermediate School. Given what I've seen so far, I think we're just going to have to wait till we get to the end, see what everything comes back, and then arrange in priority, because I don't think we're going to have the funding to do all the projects. I can tell you right now the priority for us would be to get the roof replaced at KIS and the HVAC replaced at KIS. Those are the two largest projects, and that school is in dire need of having both of those. Probably after that, if we could have funding left, it would be the lighting at A.L. Brown High School. So hopefully in 2 weeks we'll have a full picture of what's going on, but I think we're just going to have to take a look at what we have and do the best we can with it.
Can you tell me what controls are?
Mr. Whitkey can probably do a better job of that, so I'll.
Yeah, it is true both in Kannapolis schools as well as ours. Most of the control systems are typically pneumatic or electronic, but dated at best. And in the case of the Kannapolis schools, very dated. So you find, not unlike any electronic device, the pneumatics certainly, just because of age, are wearing down because of wear and tear. If they are electronic controls, they're just used up in terms of time. So what most of the new systems are using are digital controls. And the nice thing about digital controls is that you can pretty much adjust them from any place you'd like. You can do it from Will's office, or you can do it from the engineer's office, or whomever has a control in their immediate vicinity. And so adjusting temperatures and addressing weather conditions or whatnot can all be done. Startups, shut-offs can be done routinely from a remote location and can be done universally throughout the whole school system. That's ideally where we'd like to go, both in Kannapolis as well as within Cabarrus' own system. And that just makes a lot of sense from the standpoint of energy conservation, and we don't have a choice. We have to replace the systems because of age, but the digital controls are the better way to go from what they can do for you from an energy management standpoint.
So thermostats.
Yes, ma'am.
That's what I
Yes.
wanted to make sure of.
Yeah,
I
yes.
presume that's what you meant, but again, for the viewing public, I want to make sure they knew what we were controlling. So
ma'am.
thermostats either controlled in the classroom or
remotely.
remotely.
Yes, ma'am.
The new ones also control the kids.
Okay, in that case, I think we need to provide additional funding for controls if the thermostats can actually do something about children. Okay, anybody have questions of Mr. Crabtree concerning Kannapolis?
Mr. Crabtree,
Yes.
I heard that there's going to be some improvements or potential improvements to the Brown High School football field,
There are some proposals out there from the Booster Club.
about $3.5 million.
I think it's closer to 5, if I'm not
Okay.
mistaken.
And where are they coming up with that money?
They're raising that money themselves.
To improve their facilities?
Yes.
Thank you.
Mhm.
Any other questions? Okay, Mr. Whitkey.
Thank you. We have up the budget review sheet, and as I've mentioned before, typically this document lags behind, and I can tell you it lags right now in the case of several projects where we've made changes. But normally, if we are asking for changes within a school, let's say we want to move money from one project in Central Cabarrus High to another project in that same school. We can do that without having to go back through DPI's review process. We can simply ask our board and you all to approve that change, and it can be accomplished. Fortunately, the changes that we're talking about now are between schools, and so a number of those changes will not show up until DPI approves them, and then we can bring them through the normal process here. But sort of like what Will's speaking of and his projects in Kannapolis, we are seeing prices go up. We are seeing projects come in higher than anticipated in a number of cases. And we have been, up till now, fairly successful at maneuvering monies between projects. But I think, can I just take you to the next document? I think it shows a little bit better there on the milestone, I'm sorry, yeah, on the milestone projects. If we look at that document, you'll see at the rear, the second sheet, I'm sorry, we have a number of projects for the audience. The green dots, or squares rather, identify those things that have been completed, those projects that are completed. Those are 8 in total of the 42 that we had to start with. The remainder of those items below that series of green boxes are projects that have either been deleted or folded into another project in order to fund it. And I just bring that to the commissioner's attention because I think going in, we were hopeful that, I'm sorry, thank you. Hopeful that we wouldn't have to modify or change a great number of the projects. We are seeing that because of time, some of the budgets are being eroded. I think you see certainly in the area of electronics, in the area of more costly materials, that those prices are definitely going up much higher, much quicker than we hoped. And so we've had to revert to canceling some of the projects to move money to the projects that were either underway or, in the opinion of our board and our recommendations, the most important. And so if I can take you back to the first sheet, if I could, thank you. Okay. This is the projects group that we're really working on currently. There's 25 projects shown here. Of the 25, 11 of those are either under construction or going to start very shortly and will be completed by the end of this summer, ready for next semester's school starts. So approximately half of those projects will be done by the end of summer. And those are, for the majority of cases, they are under contract, they have been bid. The remainder sort of fall out from there. Most of those we are hopeful will definitely be well in hand by 2013. The completion date, I always remind everybody, is the spring of 2014, so we still have plenty of time to get all of these done. So with that, I will certainly ask if you have any questions.
Commissioners, do you have any questions?
What, how much is it going to cost for the Northwest Gym addition?
The total estimated project cost is $2,654,000.
How much is that being raised by the boosters?
None.
And I saw where the Mount Pleasant High School boiler replacement is being canceled, the middle school chillers and coolers is being canceled, and the Beverly Hills chillers and controls being canceled.
Yes, sir.
Do those projects in lump sum total more than $1 million?
They are close to that.
Why wasn't any of the money that's going to be applied to the Northwest Gym not applied to those, which is for the children's comfort in classrooms?
Excuse me. I believe I've discussed this earlier, Commissioner White. The issue with the gymnasium is an issue of safety. It has to do with an injury that occurred in a similar designed gym with raised, what we call their knee walls on which the bleachers sit. And a young man was wrestling and was thrown into that wall and became paralyzed. The Wrestling Association of the state immediately came out and said, if you have designs that are similar to this gymnasium, it's the responsibility of the school board to either address that, either stop wrestling events or do something about the design of the school so that that event can take place. In looking at the condition of the gym, at the age of it, and the other needs, it's the smallest of all the high school gyms. It seats the least amount of students. But most importantly, it was a potential hazard for children who were wrestling or even playing basketball. I don't think volleyball would have been the same issue, but with those two sports, it was definitely a concern. In addition, that school has the unique situation of being a small gymnasium. We literally had nowhere to put people who were in wheelchairs except within a hazardous area on the gym floor. There's only about a 3 to 4 foot boundary around the gymnasium playing area. And that was the only place that we could get people in wheelchairs or who were handicapped to observe and view the games. So that was a significant concern of our board as well. But I think it was a safety factor more than anything else.
My question is, you got kids that are going to middle school and high school and elementary school in 3 different locations that, in regards to heat and air, that you're impacting the entire school, and that was not as high a priority as a gym. That's what it sounds like.
Well, I guess in turn, and I certainly would be happy to bring other people along who are much more knowledgeable about the educational process. The gymnasium the way the current gymnasium is designed, it does not allow for cross-court play, which is extremely limiting to the number of students that you can have in the gym at any one time. As an example, with the new gymnasium design of turning enlarging the playing surface, it would allow us, I believe, I'm correct in the numbers, of almost 4 times the number of children to be able to recreate and receive educational programs in the gymnasium as they can now do today. So I think it's more than just the safety issue. It's the fact that it was a gymnasium that did not lend itself to the functions of the high school and the current needs. And to answer your other question about the other schools, it's not that they are without temperature control, that they're without heating and air conditioning. They do have those features. It's just that they're older systems.
Well, I was told that Mount Pleasant Middle or Elementary is without air conditioning
Mount Pleasant.
as of 2 weeks ago. Yeah.
I didn't, which school?
Mount Pleasant, I think it was Mount Pleasant Middle School was without air conditioning 2 weeks ago. When we had that heat wave come through.
Mm-hmm.
That's what was told.
We do have systems that break down, fans go out, whatever. I mean, we respond to those as work orders. I mean, Concord High School is going to experience temperatures in excess of comfortable because we're going to be taking down that chiller unit. But on a regular basis, and especially with the older schools, we pay a great deal of attention to work orders and maintaining those systems. So I would say that it's not unusual for us to be dealing with older systems. Ideally, we would, we certainly put those back into a process that we'll talk about a little bit later in QSCB 2, in round 2, to hopefully find additional funding for those projects. But to be able to maintain those for several years in the future, we can still do that. It's costlier, and it's not as energy efficient, but we can still maintain them.
Is the Mount Pleasant Middle School and Elementary School younger or older than Northwest High School?
The high school is younger. The middle school is, I believe, older.
And
by a few years.
elementary school?
The elementary school is, well, it's younger than Northwest.
Okay.
Yes.
And the wrestling, you brought up the wrestling. The wrestling, they're actually wrestling over at the Northwest Middle School to alleviate that issue. Isn't that correct?
For right now, yes, sir.
Okay.
Just to clarify, these were decisions to prioritize these repairs by the school board, not your personal decisions, correct?
That's correct.
Just want to clarify
Yes,
that.
sir.
And I will say, and I don't know, I hadn't heard anything about Mount Pleasant schools. I do know Northwest High School has been without air
Yes.
for a couple weeks. Is that correct? Do they have their air on now?
They will as of Thursday.
Okay, they've been without air conditioning for a few weeks, because I had a teacher who's in a computer lab, computers add heat, and her room was somewhere around 89 degrees, which is quite difficult to do. She had some box fans. So I have 2 windows, just to let you know, one of which I can open. It needs a pry bar to close it because the windows are so heavy. And anybody that would like to contribute box fans, when are you going to turn off my air conditioning?
It'll
Do you know?
This Friday evening, and it'll be back on when you come back to school.
Oh, they told us we were going to be without air conditioning for a period of time.
It-
You think
it-
you're going to
not-
get done over break, and that when
that
we
is
come
the
back,
hope.
it won't be so bad? Okay.
Yes, ma'am, that is the hope.
Just, I was going to beg for ceiling fans, box
Well,
fans. I was just trying, so.
And we do that, you know, whenever a school does have a system problem, we have auxiliary fans to help.
Any other questions concerning the, yes, sir?
If one of these units goes out on one of these schools and you done spent the money on something else, where are you gonna get the money to replace them from?
I mean, we do have some emergency funds, but I think, again, what I've seen, and I have to admit, I've been in this position a year, so I'm not as familiar as some of my staff are with some of the equipment, but typically, we've lost fans, we've lost condensing units, we've lost pieces of equipment. We haven't really lost an entire system. And that's because we do an awful lot in the way of preventive maintenance and trying to stay on top of them. And so I don't envision us having that sort of a, you know, catastrophic problem. Can it happen? It can, sure.
In other words, they're not in bad shape now.
They're not, no. What we're trying to do with QSCB is really address the oldest systems where we knew that they were certainly at life's, you know, typically what we call life's end for the equipment, and we felt it should be replaced. Can they continue on for a while? Yes. It just takes a lot more energy and effort and dollars to keep them running.
Okay. I noticed you saved $130,000 on windows at Central Cabarrus High School. How did you manage to do that?
That was through bidding.
That was through,
Yes, sir.
it came in that low?
It did. And we had, that was one of the most heavily responded to bids that we had.
I
And
mean, they didn't change design on windows or anything like that?
no, not at all. It was kind of interesting, because I personally thought it was going to be the highest cost as compared to the offices, but it wasn't.
Yeah, it looked pretty good to save that, for that savings.
Mhm.
Okay, any other questions?
How much
Thank you.
money does the county, I'm sorry, how much money does the county give in maintenance to the school system every year? I thought it was about $8 million. What, is that about right?
I could look it up, it's somewhere in that ballpark, but I can't
Okay.
get an exact number.
Okay, that's all the question.
If you would provide that when you get a chance, after the meeting's fine, appreciate it. Or tomorrow.
I could get it right now when I'm talking.
Okay. Okay, if there are no other questions, we appreciate you both coming, as you do every month, to keep us informed, and you have another meeting to go to, I'm sure.
Thank you.
Thank you both.
Thank you.
Okay, next up, we have, let's see, we have a number of people here. Kyle Bilfer is here, and do want to recognize Roxanne Vanakoven, our district attorney, and Judge Spainhour is here also. And
Sure.
I don't know, Kyle, if you want to start. I don't
Yeah,
know.
I'm going to start and bring them up right after, if that's all right. Preparation for the demolition of the 1988 portion of the old jail is progressing very well. The furniture and the kitchen equipment has been relocated. Complete asbestos abatement has been completed. We've also finished the preliminary design for the first floor and second floor, housing guardian ad litem, courthouse security. On the second floor would be clerk of court's file storage. In addition, we've also completed a preliminary design on the parking lot out there that would take place where the current parking lot is and also where the actual 1988 portion of the jail is. So if you could go to the attachments, I just kind of wanted to go through each one briefly. Thank you. That's pretty good right there. That actually shows the area that we've designed for guardian ad litem, since they will not be moving into the Human Services building. We basically took their current layout and basically just adjusted the space needs to fit in a better flow. If you're familiar where they are now in the Parks and Recreation building, it's not a good flow for what they do. So we were able to put everything in there with minimal changes, and also allow some of our communications rooms that exist there for the tower and ITS, and also some emergency generator wiring that we have to stay, and also leave in the area for courthouse security and their little break room where they cook their meals or have their lunches. So there was not a lot of alterations. And then obviously the second floor, the whole design of that was to do the most minimal amount of changes up there, other than gutting out the old iron bars and ripping out the footings that hold them, and then basically creating one big file storage room for clerk of courts. Obviously the design was, we knew not having the funding to build a new courthouse in the immediate future, we would be able to move the files out of the existing courthouse and put them into this area so that they could populate in terms of people in their spaces. Okay, you can go on to the next one. Yeah, that actually shows the complete layout of it with the actual space in there. And if you can go to the next one, it'll actually show. Yeah, that is the parking lot design.
Yeah. Below it was the second floor.
Yes, all you're doing is opening up, is creating that one storage room. There's nothing else there. We can go through it if you guys want to, but nothing is going to be renovated. This is the design, or the preliminary design for the parking lot, with a total of 102 spaces. And at this point, I will bring up Judge Spainhauer and District Attorney Roxanne Vanikoven. And I'll slide over you guys. Where do you want me? You can go right there or right here.
Okay, Roxanne, you want to go?
Thank you.
Wherever you want.
I'll sit right here, thank you.
So I've had a few folks from the courthouse that I deal with on a daily basis about the current parking lot that's out there go ahead and submit letters about their interest in terms of the parking lot. On the county level, we've gone back and forth with what we could do or can't do in terms of constructing it out there. And obviously, this also plays into a role of downtown parking in general for the public, and with Carolina Courts and then Rowan Cabarrus students up on the 7th floor of the sheriff's admin. I've been dealing with a committee that deals with downtown parking lots and signage, and this all kind of accumulated at once. So I kind of wanted to get everybody in the same room so that I could be giving guidance, because I've got to get going on a final design for this parking lot to figure out the actual amount we would bid it out for. So I will let both of these folks go ahead and talk about what they'd like to see.
I'll yield to you.
Thank you. Well, when Mr. Billifer approached me about the parking lot area, I shared with him what I think is the greatest concern for the staff that I employ, and that is a safety issue. He showed me the design of the parking lot, which is what's before the commission tonight, and although kind of small that you can't necessarily read, there are 11 spots reserved in the secure area of that parking lot for district attorney staff. I shared with Mr. Billifer that that would be exactly what I would have asked for. We have 10 attorneys in the office, counting me, and 1 investigator. Currently, we have parking over in the designated lot behind the courthouse building. We have 11 spaces, which is what I had originally asked for when that lot was being transferred, so to speak. I could spend a lot of time sharing with you specific stories, but I think it goes without saying that when we work in the courtroom, we work to protect the streets, the neighborhoods, and the people that live in this county. And we are asking for those 11 spots so that the people in there fighting against crime can be protected when they're coming and going from work. I could give you countless examples. My tires have been slashed. We've had assistant district attorneys' cars that have been keyed and egged. And there is no question what that was prompted from, because we either have a very hot case going on in court, or we have a family member of a defendant who we're prosecuting who is very unhappy, that has either come in the morning and made clear, or left in the afternoon and been very upset. A couple of specific examples I'll give you. I submitted a letter to Mr. Billifer in lieu of this meeting, or to prepare for this meeting, and 2 days before, as I was leaving the courthouse, there was a man on the sidewalk that I have personally prosecuted and has approached me, who's quite a volatile type criminal, who I saw standing there, started mouthing things to me. Of course, I'm walking to my vehicle and pretending that I don't see him. Fortunately, I was with another prosecutor from the office at the time, but realized as I pulled out, now he knows exactly where I park, when I leave, and what I drive. So there is a true safety concern. Just two other examples I'll give you. One day in court, as one of my assistant district attorneys was calling up a defendant before the court charged with very violent crimes. This particular offender, when walking past the assistant district attorney, said specifically to her, "I know where you park and I know what you drive." So there's no question that as the years have passed, I've worked in that office now 16 years, criminals are more callous, courtroom situations are more volatile. I think you've obviously recognized that by the fact that you've put a metal detector in the front of the building and secured the front of the courthouse so that people can't just come and go as they please without being safe and secure. Without going through multiple more examples, we've prosecuted cases before for people who have been murder for hires. There was a particular case that I personally handled a few years ago where after convicting the offender, we had a confidential source of information, our informant, although this offender was in jail, that shared with local law enforcement that the offender was putting hit out on me personally. And fortunately, nothing came to fruition. But I do think it is a safety concern for the assistant district attorneys that work in that office, because we're the ones standing before the court on a daily basis, sharing with the judge their criminal records, their violations of the law, ultimately asking the judges to send them to prison in many cases, cross-examining them, their friends, their associates, their family members. So for those reasons, as I outlined in my letter, we are asking that we do receive those 11 parking places within the secure facility. And I think if you look at the situations that have occurred across the country, many times when there's violence in the courtroom or just outside of the courtroom, they're usually coming for either the prosecutor or the judges. So I think it's imperative that I would do everything that I can in my power to make sure that my staff is safe, and I'm asking you to help in that regard.
I agree. I apologize. I have laryngitis, and for that reason, it's very difficult for me to speak normally, and I just ask you to bear with me a little bit. Well, the judges are the ones that have to say, young man, usually, you're going to prison for 40 years, or life, without parole, or death. I had the duty to say that last thing just before Christmas in Stanley County. So these are very difficult situations, and emotions run high. And we do need to be in a secure parking area. Now, the way this is designed, there are spaces for the judges and their staff. We have a number of times during the year, we have 2 superior courts going on, and of course there are 3 or 4 district courts going on all the time. 8 weeks a year we have 2 superior courts going on, 1 criminal and 1 civil. But we have criminal court 2 out of every 3 weeks, and we have on the 3rd week we have civil court all year long. We handle a tremendous number of cases, and the way this parking lot is designed by Mr. Billefer, the judges and the DAs, and some of their staff, certainly all the DA staff, I think. Is that right?
Well, the attorneys.
The attorneys will be able to enter that secure area and go directly inside the courthouse. That is normally what happens in most counties. For example, in Gaston County, they have almost exactly the same kind of configuration right next to it. And I think surely if Gaston County can do it, so can Cabarrus, folks, really. In Mecklenburg, it's the parking lot is under the building. That's very expensive, not asking for that, of course. Perhaps sometime in the future we could do that. But most counties where they have considered this have done this kind of thing. Also, we do need I do need to let you know, you may know it already, but I'm not sure you do. You know, we ask our jurors to park in the large parking area just this side of Fifth Third Bank on Church Street. That's fine. We don't want to make people that would be parking that work in the courthouse. We don't want to have to move them to that parking lot down there, because that will make it even more crowded in the parking lot provided for jurors. The general statutes of North Carolina, and I happen to have brought a copy if anybody wants to see it, 7A-304 provides that the county must provide free parking for jurors. We do that. It doesn't say how close you have to be to the courthouse or any particular numbers of places, but you do that now. We don't want to have to burden that lot with more people from the courthouse. I asked the security folks at the courthouse about how many people work in the courthouse. There are about 150 people that work every day every day in the courthouse. And that doesn't count the 1,800 people that come and go through that security slot, the security thing. That's astounding to me, but they know how many people come through the security, and it's about 1,800 on average on a normal day, which is an amazing amount of people. So there's a lot of coming and going. Now, security inside the courthouse is terrific. I'm very happy with that. The danger comes, as Ms. Vanakoven has said, from going outside the courthouse to the car. And then, of course, in the car, fortunately, I haven't have not had to ask for an escort from the courthouse to my house or wherever I'm going. I have had that in other counties, escorting me all the way home. That's how tough it can get. And when families don't like the idea that one of their relatives, and understandably so, is going to have to spend a lot of time in prison or worse. So it is a very serious situation. I'm sure all of you remember the situation down in Atlanta when somebody got loose inside a courthouse, killed a judge, a court reporter, and a prosecutor and all that. We think we've kind of got that solved, that situation, thanks to you folks or your predecessors, because of the security system that now exists over here. I can assure you it is not that way in a lot of counties very close by. People can walk in just about with anything they want to, and so people have to be very alert sometimes. But I want to thank you for what you've done for us and in providing the facilities that we have. They are excellent. We're going to be bursting at the seams very soon, but we can live with it for a few years, thanks to the renovation of what's now courtroom number 6 down on the first floor, which we all went through a couple of years ago. But we need to have that approved as it is. Thank you.
Kyle, I know we have money, or Pam, I don't know which one, we have money budgeted for this project. So, I mean, it's been in the budget.
That's correct. It's a CIP project.
Any idea on how you think the bid, you haven't bid it yet, obviously, on how
No.
you think the bid's gonna come in? Do you think
No.
we're gonna be okay on the budget, or?
Well, yes, any which way we do it, I do think we'll be okay with what we've designed. But the Guardian ad litem design, we just finished that, literally that preliminary, we just finished last week. Up until then, I didn't even know that they were going to go there. So, no, we have not had time to bid this out or anything like that. You're talking about a significant amount of engineering to be able to demo that building and not lose services to the courthouse. I mean, the utilities alone for those 3 buildings, which it's actually, people think it's 2, but it's more like 3 buildings together. It's significant. We've been working behind the scenes to disconnect different water lines and emergency generator lines and things like that, so we can literally just go in there and cut it down.
And the expense in the parking lot of making the secured lot? You say address this, that's what they're both
Yeah.
asking about. I presume that the design, renovation design of the building is fine.
Yes,
That your biggest concern is the parking lot.
that's correct.
The
Okay.
expense of putting a secured parking lot,
I understand. If you're talking about the areas that are inner secured with that fence, all I can do is draw upon, past of doing certain things like this with fencing and those type of operators and rolling gates, and that whole thing, is a $50,000, could be plus expenditure. That versus not having it in there at all. But I will tell you that even shrinking the size of it, of the actual secured part, is going to about prove to use up more spaces. Because my problem is with designing that is I've got to have a place for the rolling gate to move to. Okay, so there's only so many configurations I can make that happen with traffic flow and make it all legal. And we're kind of locked in certain ways by basically where you leave on Corbin and where you come in on Means. There's not a lot of angling with the city on, hey, can we just pop a driveway out onto Church Street, So I feel pretty confident with saying that with those operators and that fencing, you'd be looking at, $50,000.
after 5 o'clock, courthouse closes. The spaces that are not in the fenced-in area, will we have county vehicles parking in those, or will those be available to the public? And as you mentioned, Rowan Cabarrus Community College, would that be available? Some of those spaces, would they be available for the general public after business hours?
Well, discretion of the board, we'd have to work on it on everything. Could I make those parking arm gates lift up at 5 o'clock and have people get in there? I certainly could. I can't swear that everybody on the exterior of that secure area will leave at 5 o'clock.
Not the secured area.
No, you're talking the
other
unsecured.
spaces that are not secured,
Well,
specifically up there around the road,
yeah,
in that next row of 58. I don't know exactly how many are there.
Yes, that's the intent, to raise the arms after 5 o'clock. If they're there, they can stay there. If they move, then it's first come, first served in those spaces for the ETs.
24 of those spaces are for probation, so they are state cars. Sometimes they're gone, sometimes they're there. There is no rhyme or reason to it. Trust me, I'm the person they call when something's parked in their spot. So I can tell you, yes, there will be open spots, and yes, I can make the parking arm go up at 5 o'clock, and I can put the best signage I properly can out there. I know we'll have issues where somebody comes in the morning to work and there's something still in their spot, but we'll just handle it the way we handle it.
Commissioners, questions, please.
What will the fence look like? Have you gotten that far in your design? Will it be, will it have something secure on top so someone can't climb over the fence, or?
We'll be at the mercy of City of Concord downtown limits. So we've had some discussions
And it
with
ain't
them.
gonna cost $50,000.
Well, yeah, I've expressed to them what we want. They've seen a layout of this, just so you know. I would have never went this far. After building the other buildings across the street, I kind of learned a lesson. We've gone to them and kind of explained what we wanted to do, and that's an inner fencing. So they're maintaining that as long as we keep some vegetation around where church and means is, that they'll be a little bit more lenient than they were on us in terms of what we put over at the admin parking lot for the sheriff's department. But I will tell you, the fencing will have to be some sort of black decorative, or it will have to be a PVC coat like what we did up at Human Services on the side of the building where the Priuses are parked. I'm sorry, Camrys.
I think it looks like a good idea, a good plan. I've actually been surprised that there's not secure parking by now. I've always kind of wondered that, so I think it'd certainly be a good addition.
Is it are we looking also, we got, of course, active security measures with the fence and gates, but looking at passive security measures too of, I don't know how many cameras we have out there right now, well, in that parking area, but putting additional cameras out as well as part of it too.
There's no cameras out there now.
Yeah,
Not that
yeah.
operate, no.
Yeah.
We've talked about it. Todd Shanley from ITS and I have spoken about it, the capacity of the system, since we are running some of the card readers out there. It's one of our desires for the actual, where the entrance is coming off of the secure parking lot, to be able to get an angle of the secured area.
So I think Judge Spain, I would love to make an example out of somebody that he caught out there and tinkers like car.
Just wait. Better not say that.
Wouldn't it be less expensive just to put up cameras and then have a deputy escort, if that's the case?
If you want to pay them overtime for my staff to walk us in and out, I don't think there's a specific time necessarily that
Well,
everyone
I'm not
leaves the
saying,
building.
I'm not talking about overtime there, but we got people in the jail, we got people in, in the magistrate's office. There's additional people that if security is an issue, that's one thing, that we can look at. Because, I don't think it's gonna cost $50,000. I think Kyle is being conservative on that. I think it's gonna be much more than that based on when all is said and done. Safety is important. I know Rowan County does not have secure for the district attorney's office.
Let me,
I'm not certain about the judges.
well, glad you brought that up. In the courtroom, in the Superior Courtroom.
Yes, sir.
It happens, it looks out on the parking lot, right down on top of it, where the judges park. Now, they've got it so that the Superior Court judges, there are 2 slots there, are right there on the corner of South Main, or I guess it's North Main Street and whatever that street is that runs by the entrance to the jail.
Liberty.
So, yeah, I believe it is Liberty. And so one day I was holding criminal court up there, and Mr. Kennerly, the DA then, came in and said, well, we've taken care of the problem with your car. And I said, what's that? He said, well, they noticed a fellow out there with a camera and a friend videotaping your car and others, and we went out to inquire about what was going on. And, it's right out there in public. And so nothing really happened about it. They ran those people off. But there was, why would you be photographing a judge's car? And so from then on, I parked somewhere else that they made available for me. But this is the kind of thing that can happen, and it's not a good feeling. Rowan County is not a good example. I love to hold court in Rowan County. It's one of my favorite places to go. But it's not a good example for security for vehicles, for sure.
In Mecklenburg, or when I was in Mecklenburg, we didn't have secured parking. I don't know if it's changed over the years.
Oh, yes.
For the DAs. For the judges, they were always parking underneath.
I'm not sure about the DAs.
But I don't know about the DAs. I think I tried to find out before this meeting to find out, but.
I'm not sure. I know there are 15 district court judges over there all the time.
Right.
And there are usually 4 or 5 superior courts going on. And the only cars I've noticed down there are the judges, both district and superior, and the county commissioners. They have parking down there.
Well, we don't. Is there not some spaces here in this building down in the basement? Or?
I'm glad you brought that up. When I first went on the bench several years ago now, I rented a spot downstairs, and Karen Whitley, my trial court coordinator, rented a spot right next to her. Now, her car had a tag on it that said TCC-19A, Trial Court Coordinator, Judicial District 19A, is what it meant. Well, her car was stolen from that spot right downstairs ended up in South Carolina in a pond.
Sir, I'm not talking about the garage level. I'm talking about the basement level.
Okay. Well, I don't know.
I didn't know if there's anything there. And then the second is, how many spaces do we have over at the Sallyport? Because those aren't being used during the day for the most part. Because you have the internal spaces as well.
There are no open spaces on the basement level, and there's a
That's in this building.
And there's a waiting list from our employees to get in there. There are a lot of the police officers that actually go to court every day are parking in there already. But as far as the Sallyport, I'm not sure how many spaces are there. I know the sheriff doesn't want to use it.
I tried to look this morning, and it looked like, from an aerial photo, it looked like there was probably about 12.
That's probably.
But I'm guessing.
Inside the Sallyport, you'd have to.
Not inside. I'm not talking about inside. You go through the doors.
The dungeon doors.
The dungeon doors. You got that space, and then I'm talking about that space inside the dungeon doors, but outside.
I know exactly what you're talking about, by where the generators are in the retaining wall.
Yes, sir.
Yeah, they park a couple of their bomb vans there and charge them. I know one of them's at the shop now. I don't know if they're there all the time. And then they usually, when my maintenance guys try to park in there, I hear about it because obviously that's where they're doing inmate transfer, where their vehicles go in from other counties. We can inquire to them.
I mean, that certainly would be a secure location for y'all.
I didn't know you had a dungeon over here, Mr.
Well.
It's news to me.
It's the dungeon doors. But,
Okay, well, I think that we need to give some direction to Kyle as far as all of the renovations inside the building and the parking lot as to what the preference would be, so he'll know what to bid out. Because he doesn't need to bid something out and then us turn around and say no. So just to go, we've heard from 2 commissioners. Let me just go one by one. Commissioner Meisner, do you have any comments about either the parking lot or inside, or yes, no, or
Just
changes?
like I said earlier, I think it looks good, so. And I think if, we were to consider parking, elsewhere, you still run the issue of walking out of the courthouse and still being on display, or still being prone to someone approaching you, trying to cross the street to go over there or come over here. So I think it's a good idea.
Commissioner Burridge?
What's in the budget to do this whole job?
It was $1 million last year. And that was for the demolition, the tear out, the gutting, and $2 million.
Well, that fence you put up over there won't stop bullets, will it?
Nope, but it'll keep them out maybe.
Well, people outside that's shooting in there won't do a whole lot of good, though.
Well, I think the problem they've had so far, fortunately, knock on wood, has not been that. It's been tires and keying and threatening, is
It-
what I
yes.
understand.
It has been, and I mean, obviously, a tire can be replaced, a prosecutor cannot. And while I understand cost should certainly be on everyone's mind, and as Judge Spainhour shared, Rowan County is not a good example. There are many other counties, Union is one, where DAs do have parking under the building. They don't even have to go in or out of the building, and we certainly don't, we're not asking for anything excessive, but I do think it's important that the people that fight to protect our streets are at least protected going in and out of work each day.
Commissioner Burridge,
I think it ought to be done, if that's what's needed.
Commissioner Caruth.
I'm generally supportive of it myself, and I'd just like to say that, you know, given what we're at right now, the cost stuff is that there's the extra cost of the fence. And I don't know if we can bid it with option with the fence and, you know, the base, and then what would be a bid with that additional so that we can look at that.
Yeah, I can put those in.
Yeah, so, you know, I'm
as
saying something where we
alternates.
can look at it separated out. So that
Yeah,
maybe-
but it would be okay, and yes, I understand what you're saying, but I need
You
to
gotta-
design it the way it is with the islands where it is,
Right,
with
oh,
or
yeah,
without
yeah,
the fence.
Yeah, I
Okay.
understand that. Just, I'm thinking just the fence and the gates was what I'm thinking. Is that, would that be like an optional bid?
Yes,
or
I can put that in as
something
an
if
alternate.
If we see that we can't afford it, we can at least have it designed so we can add it later, or as money comes available.
Commissioner White.
I'm concerned about the amount, because I think it's gonna be more than $50,000. I'm also concerned about the number of spaces, is not certain why a county attorney needs to be in there. We haven't heard anything about it. Rich, have you had any problems coming, or excuse me, Mr. Cook, have you had any problems coming in and out of the courthouse?
I think that's DSS. I don't park in that lot.
Well, you know, I think I'm concerned about the number of spaces and also the cost. And I also think that if you look at the number of DA spaces and the number of judges that we typically will have, I would like to first look at the Sallyport area, because that's secure. And to address Commissioner Meismer's concern is there's always a tunnel they can get across if there's a concern, so they have no access. They're not out in the public. And then second is also look at, is there anything in this building of some secured parking spaces that can be addressed there.
If, and the one thing about the spaces, as I understand it, is that you design the spaces, that particular number, because that fits the configuration of.
I agree. The county attorneys, guardian ad litem, all that didn't need to be in there, but I had to come up with a certain amount of spaces to provide those islands where they were. And rather than breaking up probation or courthouse security and putting half of them inside and half of them outside, that's what I came up with. In fact, when I went to courthouse security, I was gonna move them into the secure area, and they actually had requested being on that outside of that fence like that, so they could look at people that they thought might be walking around the parking lot, looking inside the secured fencing, so that they could, I guess, in terms of being on a lookout for the DA's office or the judges. But it was just a number, and it came down to how I could split it up. If I could build it small enough just for the entities you all want to put in a secure lot, I would, but I can't. That's the best configuration that myself and the architect can come up with.
Well,
If it's bid as an alternate, with that at least, and then if Kyle can get back some information on the Sallyport parking and the other questions, is it okay if we go ahead and get him to put it out for bid?
that's fine if you want to. I mean, I have no problems with them putting it out to bid. Those are just some things I was wondering, is there another way that it can be addressed without having to spend the additional monies?
I would say that if, I'm okay with you putting it out for bid, put it as an ad alternate, just so you can identify the cost. And then, you know, obviously, once you get the bids, you're gonna bring that back to us anyway.
That's correct. We're ways away from that. We have a lot more engineering and design to do.
Right.
This is just the preliminary.
Right, and we don't want to hold you up any longer than we have to, so I think I have a consensus from everybody to allow you to move forward, and, you know, we can identify the cost, and then I'll be positive and believe that it will all come under budget and it won't be an issue.
Was the cost of this included in the other funds?
Yes, sir. Parking lot was included in
Okay.
that entire project of demolition of the old
And you
jail
think you
and the
do it for
renovation.
$50,000?
And the parking lot.
I'm basing off what we spent on the DSS secure lot and basically adding one more operator. And yeah, that's the amount I think. But now, that was with, you know, a PVC coated chain link fence, which when I talked to the city of Concord, they said that because it was an inner area and wouldn't be seen on street level, that they would be okay with that. But that could change, and we could end up with a decorative fence at 6 feet high, and then yes, your costs will go up.
What does CHSEC mean?
Courthouse security.
Courthouse security, this is the deputies.
So they need 15 spaces?
It's the number I was given by Lieutenant Aldred about how many are working in there.
Where do they currently park?
In the old parking lot right now.
Okay, thank you all very much, we appreciate you.
Thank you very much.
It's been a long meeting already, I know that. We appreciate you both
Thank
coming. Next up, Kyle again, options for the Old Bethel school property, which was tabled from the last meeting, or
I'll take that. Yeah,
County
we've,
manager.
in dealing with the group that's looking at it, they've asked for another table till May, and they promise that this will be the last one.
How many times has it been tabled?
Yeah, I believe this will be the third time. They plan to have a meeting this week to make their final decision.
I vote no. I mean, this is the
and
third
the
time.
other option would be that we have to budget the money to demolish the
Yeah.
building. I'm okay tabling it because I don't want to spend the money.
I'm
If there's
on-
any way for us not to spend the money, I don't want to spend the money.
I'd make a motion with table it.
I second.
Okay, we have a motion and a second to table it for the last time to the next meeting,
For the last time, yeah.
for the last time. We'll make sure they know this is the last time. We need to get a move on. Okay. All those in favor say aye.
Aye.
Any opposed?
Aye.
4-1. Okay. Next item concerns we have Kevin Grant here and Kyle concerning the construction and demolition landfill, and county manager may need to weigh into.
Last month, when we were discussing this, I think we went over the fact that the state was agreeable to look into an unlined section to expand our landfill, provided that we do a couple rounds of groundwater sampling just to determine the current nature of the groundwater situation that we have. We conducted our first sampling about 2 weeks ago. We have not got any results at this point. The second round at this point would be the third week of April. So I'm thinking that sometime in May we'll have a good idea in terms of what the numbers look like, and we'll submit that to the state and hear back from them in terms of what we can do and how much acreage we have out to the south of our current landfill to expand. I also just wanted to report a little details of the Greenway proposal. This is all conducive if we can get a 17-acre expansion. I'm not sure or highly doubtful that we're going to get that, because one thing the state did recommend is a 250-foot buffer separating our old municipal solid waste section and then the current expansion section. So if that buffer is going to stay intact, getting 17 acres would be very tough. So not sure if this will even fly with Greenway. But as you can see, they would operate the landfill, responsible for all expenses, pay us a $5 per ton tax or tipping fee for any incoming C&D. We would still be responsible, or they would provide financial assurance, but we'd be responsible for post-closure monitoring, engineering, expansion, and closure, also maintaining liability for the landfill and overseeing scrap tire and probably yard trash as well. So like I said, there's not even an issue to really consider right now, because I'm not sure if we're going to get to 17 acres at this point. Like I said, probably have a better idea in May or June whether, in terms of what type of land we'll have. We've looked into some initial cost in terms of engineering if we went on ourselves. We did about a 2-acre assumption in terms of expansion. It does look like if it's a fairly simple expansion, just like the recent one we just conducted, that we could probably pull it off ourselves and probably reduce the general fund liability for contributing to closure and post-closure. But like I said, at this point, until I find out exactly the type of land that I've got to deal with and the extent of the construction, I don't have a good idea at this point. So that's about all I have for this update at this point, if there's any questions.
Yeah, just add real quick if it's okay. Kevin, based on the 10-acre or the 17-acre expansion and the Greenway offer, is it feasible that we would consider that offer, or is that something we can go ahead and discount now and just look at the future as if the county's going to operate?
Based on what they presented to us and information I have, I don't think it would be a good idea to work with them at this point, based on this current proposal that they're giving us.
Okay. So, I guess let's talk about Greenway first. I guess the recommendation you have is that we go ahead and take care of that now, just by consensus? That's not going to be the option? Is that your recommendation, sir? Okay. Any questions or comments?
What is the recommendation?
The recommendation is that we don't work anymore with Greenway to try to come to a, doesn't appear to be a symbiotic relationship that, so we could tell staff they don't need to worry with that
I didn't
anymore.
think it would be.
Anybody else have any questions or comments about Greenway?
I don't know why we'd even work with them and us keep the liability of it.
I think that was the whole reason of trying to work with them to begin with, so.
I have a lot of comments, but I've expressed those in the past, and we won't rehash that.
Thank you, in
See
the
prior meetings.
consideration of the time, thank you.
They did well, they took away the dead trees and replaced them with about 2-foot trees that's been about a year and they haven't grown at all.
That's still trees.
Considering that you can see right over them and see into the landfill, but anyway.
Okay, I think the consensus would be then that we would go with your recommendation and not worry about Greenway, and then you'll come back next month and let us know about the expansion, or if we need to plan on the closing.
Well, like I said, we'll probably conduct our next sampling in about 3 weeks. Probably will not see results till mid to late May, so I'm not sure that we'll, or in fact, I'm pretty sure we won't have anything in May, so June would probably be a better time frame in which hopefully I can put a package together and show what we're able to do and give a cost estimate of what we got.
Okay, so we'll put this back on for the work session in June, and I would presume that as far as the budget goes, that you would need to consider worst-case scenario, which you're probably already doing.
Well, we've already planned for the 2013 budget year as far as what our needs are. It's just a matter of whether you're going to continue past 2013.
Yeah, right now we have, I think we discussed, we have airspace through at least June of 2013. We'll be doing an airspace analysis probably in the next 2 months to give us a better snapshot of what we have out there at the current time. But that was just based on when we opened that recent expansion in terms of what we got for airspace. And this was the whole purpose of doing that expansion, was to give us some time to look into future expansion of what we have to work with out there.
Okay. Thank you very much. Okay, the next item we have is Food Policy Council retreat and their goals. We have Aaron Newton here, and after this presentation, we'll take a 10-minute break. Okay. Seems that this worked better in the flow of things to try to get through this section of discussion items. So welcome.
Thank you. Good evening. We're also joined this evening by Patricia Kramer, who chairs the Food Policy Council, and David Kataja, who is the Outreach Committee's chairman, and they're going to share with you a little bit about the Food Policy Council's annual retreat and their goals for 2012.
Thank you for having us. Just as a recap, the council has been established for about 2 years. In June, it'll be 2 years. We have 23 members. Presently have 3 open slots for membership, and I'm just going to touch on some of the highlights of the council since its inception. As I said, we were formed in June of 10. In September, we began actively participating with both county and community goals and objectives, and we supported the county fair. We had chefs that were on site to provide food displays, as well as educating the community on the NC 10% and other areas. In October of that same year, the Board of Commissioners adopted the 10% local food purchasing policy as recommended by the Food Policy Council. Moving on to February of 11, we held our first retreat. Out of that retreat, we set our mission statement, we set our 2011 goals. We were able to provide structure for our committees and focus, as well as adopting or discussing the bylaws that we then adopted at the meeting following that retreat. So the retreat's been very productive in terms of helping us keep on track. In June of 11, we had a social with both the Board of Commissioners and the Committee for Sustainability, which was newly formed that year as well. October 2011, we supported the Piedmont Farmers Market with both their Harvest Gala as well as their silent auction, or all things supported by the that gala. And then in 2012, we held our second retreat and came out of that with our 2012 goals. I'm going to touch on the high points of what the goals are. For 2012, we're looking at integrating local foods into our school system, engaging the community in all things local relating to food, and raising awareness through events in the community and also beyond the community. David's going to go into some more specifics regarding some of the goals.
Yeah, I guess a year or so ago, we worked on and developed a locally grown logo, which is our symbol of what the Food Policy Council is trying to achieve with sustainable and superior as part of the message of this logo. And what, at least my committee is focused now on developing a very robust, easy, interesting, and engaging web presence that goes beyond a mere description of the Food Policy Council to something that covers the various members of who are using the locally grown logo, who ability to find a map with local farms and producers and farmers markets, a section that will help people understand what they can do with the food that is being grown and displayed and sold at the farmers markets. You know, as the seasons change and different things become available, give them ideas for recipes and helping feed the family. It was interesting with the Health Alliance hearing about their concern with their clientele with various nutrition needs and of course the obesity problems. I think more and more people beyond their clientele, but general residents of Cabarrus County are becoming more aware of what they are eating and maybe what they ought to eat, and is there a way to eat better, I guess. And so that's the goal of what this website will be, and we hope in the next couple months to have it live and active and working. So
that's an overview of the three categories of the goals, but are there any questions regarding the specific goals or the retreat itself, or in general regarding the Food Policy Council?
I had a question. You mentioned there are 3 openings, and a number of your positions are very specific, the type of people that you want on the Food Council, what they can bring to your group. So can you tell us of the 3 openings, what categories they are, or there's certain needs in case somebody watching this show realizes that it might be something that they're interested in?
Certainly, the 3 categories are the medical industry, at large, which we could use anyone who has enthusiasm and interest, and also technically there are 2 alternate positions built in. These are 2 members who we treat for all intents and purposes just like regular members, but there's a voting deal where they wouldn't have a vote if all other 21 members showed up. So basically an at-large seat as well. I'd like to point out that Tina Farmer, who is unfortunately going to leave us, she's moving out of state to take an opportunity of another job. She was our link with Cabarrus County Schools, and so she filled the role within this medical category as a child nutrition specialist for Cabarrus County Schools. So she was sort of doing a dual role and being a liaison to education as well within the community.
So maybe we need to kind of make it known that somebody in child nutrition in either Cabarrus County Schools or Kannapolis City Schools, that we would like for somebody to step up and fill that position once she moves. Would you say that's correct?
Absolutely. One of the 3 categories, and I would say the one that will require the most effort is integrating local food into schools. And so any representation we could have either officially on the council as one of these 3 openings, or we're working with a lot of citizens who aren't serving on the council for one reason or another, but who are willing to give their time and effort and energy. So even if you're not willing to serve on the council and you'd like to, we're certainly willing to engage you even as a non-council member.
And I know that in your goals, I was interested in the schoolyard gardens and the curriculum and the pilot site cafeteria. I'd suggest that you talk to Hickory Ridge High School, because they have both the horticulture program and they have a culinary program. And they have a wonderful lady that's their instructor, who used to be an instructor for Johnson & Wales University. And Ms. Pritchard, she might be interested, but I would think that because they have the horticulture and the culinary, that might give you a transition. At that school might be better than, say, my school that doesn't have horticulture. So for you to get something going at my school would be a little bit more difficult, though I would welcome it, but it would be a little bit more difficult. So that might be.
Yeah, that's a great
I think
suggestion.
Hickory Ridge would be a good suggestion, and Mr. Wick, he's here, he can take that back, or of course, any of us can get in touch with somebody in Dr. Shepard's office and see. Commissioners, do you have questions or comments about the Food Policy Council?
For today about Joe Rowland working out at the incubator farm. I thought that was really good. Can you touch a little bit about the brainstorming sessions, about the farmers co-op, the eBay for food, things of that nature?
Well, those are, brainstorming is an exact word for it. It was, I think, at the end of our session, and we were just kind of throwing what-if ideas or blue sky ideas or best possible world ideas without much notion of what was going to take to make these reality. But, there are people we hear in the community who would love to have a food co-op going. And I don't know if the Food Policy Council can take that task on itself, but we certainly feel that what we're trying to do, I think, is be a conduit or a focal point for hearing and learning what is going on in the community. And our website, we hope, as part of that, would be have a certain interactive component where people can post messages, an ongoing blog, if you would, to engage in dialogue like that. And eBay for food, that's how would that work? I don't know, but I see this website as something as simple as like it could be like a swap meet. You say, I've got tomatoes coming out of my ears. Here's where I live. Who's got corn or beans or, and that is all local food, being put to use. So I think our hope is that this website is going to turn into something that'll be a pretty powerful tool.
As a consumer, not a grower, as a consumer, it would be nice that if it's possible, if on the website you could have, in my mind, I'm looking at a Google map or a map,
yeah,
with different points that I could, if I'm at point X, you got a little toggle, you touch it, okay, they got tomatoes, Barbie Farm has got lettuce and, gosh, I can't think what, potatoes right now.
Right.
So, be able to say, I'm in close proximity, and I know I can, and it's not that far to get there. I don't know if that's possible or not, but that's
We
certainly.
believe it is possible, and that is, one thing we definitely want to have is an interactive map of just what you're talking about.
Okay. And when's the groundbreaking for the Piedmont Farmers Market?
That's April 14th at 11 a.m. at the Master Gardener's 7th Annual Spring and Herb Festival at the Wine Cough Market location on April 14th.
It's a big weekend for ribbon cutting, apparently. Other comments? Can you touch on the community garden idea is that coming to pass this season, or?
Yes, and in fact, I'm going to cover that when we look at Elma C. Lomax and the expansion of scope. Later on as an agenda item, we'll cover the community garden, if that's all right to do.
That is perfectly fine. I just didn't want to make sure that I didn't miss that one. If I'd flipped my paper over, I would have seen that one, so. Okay. We appreciate both of you coming. As an aside, you probably know my daughter is a member of that council, and she has very much enjoyed working on that one, and I know that you're working hard to help the community understand about local foods.
Commissioner, if I could add just one thing. We held this retreat at the Lomax Incubator on February 4th, which was a Saturday. We had 20 participants, including one non-council member, just a general public member, show up. So we had 20 people who gave up the better part of a Saturday to come out and to talk about what food looks like in their community now and how it could look better. So I was really proud of that as a program, and I felt really grateful that we had that kind of response.
Trish and David, thank you both for
Thank
coming.
you.
Thank you very much.
Thank you. Commissioners, let's take a 10-minute break, please. Come back about 1:45. Thank you.